This conference will now be recorded.
Okay, so welcome you all again. So what we'll be doing in today's class. So I'll be explaining you about CTG, like starting from very basics. Then there will be CTG traces, so that you people can yourself like do that. Then there will be part 2 questions. So it is going to be take a longer time. Fine. So now let's start. So this is basic things. Everybody knows it. We are working in the hospitals. So this is a CTG machine. This kind of monitor is there from and it is connected to a printer. And then from printer, the trace comes. What we see usually in the machine, these two transducers are there. So one is called TOCO. So that for uterine contraction, and one is cardio. That is for fetal heart. Okay, so though it is not required for the exam, but just basic information. Now this is again from the nice guidelines. Why CTG is done. Okay, it is important for part 2 people and also for part 3. Why? Because you will get an SPA with regards to indication of CTG. You have to remember it. Everybody knows it, but a bit again revision. So when maternal tachycardia is there, when temperature is 38 or more, or it is 37.5 for 2 times, uh, like 1 hour apart, when there is suspicion of chorioamnitis and sepsis, when there is a pain that is reported by a woman different from normal contractions, when there is meconium or there had been a bleeding during labor. Okay, so these are the indications. Then apart from this, it is a
Dr. Priyata, these are
yeah.
indications for admission CTG or they are indications for continuous CTG?
Okay, good question you did. So in UK, they're not doing admission CTG. Okay, if a patient comes to a labor ward, so they will not do CTG for everyone. Okay, so these are the indications. If they, when the patient comes to labor room, they will assess the patient. There will be clinical examination, including like general physical examination, abdominal examination, and vaginal examination. In that examination, if any of this indication is there, then they will start on continuous CTG monitoring. This is one thing. Second thing, you admit a patient in labor ward, there had been no issue, but all of a sudden when she is in labor, like you find she develops vaginal bleeding, then you will put that patient on CTG. Okay, so in UK the things are different from rest other part of the world. Like in our practice we do CTG for everyone, but in UK it is not like that. Therefore it is important to learn the indications of CTG, and this is copy pasted from nice guideline. You have to learn it. Part 2 people, because they will ask SBA from here. Okay, have I answered your question?
Yes, ma'am. So these are all indications for continuous CTG monitoring in the UK.
Yes, in the UK, because we are see this class, what I have made, everything will be UK practice and nice guidelines, because we are studying for UK exam. So no other thing I have included in the class. Fine. Then these are continued indications. Hypertension. Okay, so severe hypertension, and if systolic more than 140 and diastolic more than 19, and it is two readings they have taken 30 minutes apart. Okay, then this is like if they have done urine dipstick, if it is 2 plus on one time, or if it is a single reading, uh, the single reading of this, or along with it either systolic or diastolic pressure is raised, or if there had been delay in labor. Okay, so for example, if the patient was doing very well, all of a sudden you find, okay, this labor has been delayed, then that will be indication that was not there when the patient admitted, but now it has arisen. Okay, so this is indication of CTG. Then this you have to remember. If the contractions are lasting more than 60 seconds, then they are causing this as a hypertonus. And if there had been more than 5 contractions in 10 minutes, this is stachy-systole. This stachy-systole they have recently added in this guideline. It was not there previously. So you people can get one question SB from here as well. Okay. So these are the indication of CTG from the NICE guideline, and you have to remember them because they ask direct question from here. And oxytocin use is always an indication. Okay. Then again, uh, epidural use. So Ankita, epidural use in their guideline, they have not said that every patient of epidural use should go for CTG, but usually they offer epidural if they put patient want they want to put patient on oxytocin, and with the oxytocin it is an indication. Fine. So, Ankita, if it is part 3 question, you can say, yeah, we will put in heart race. But for part 2, you cannot put epidural use because it is not there as a direct indication in NICE guidelines. I think, hope, Ankita, I
Okay,
have
ma'am.
answered.
Yes, ma'am, I got it. Ma'am, because somewhere there was a question and there was option like epidural and CTG. That's why I'm asking, ma'am.
Yeah, that's fine. But you know, whatever the answer you have to give, your Bible to answer is NICE guideline.
Okay, ma'am.
Fine.
Thank you so much, ma'am.
Yeah, okay. Then, you know, whenever the CTJ is given, there are two type of questions come. CTJ is given and you have to do interpretation of that. That is easy, you know. But second type of question will come. They will give some scenario and then they will give some CTG. Then you have to do the interpretation of CTG, and also then you have to read a scenario and you have to make a combined decision. So what it is not on the basis of CTG, you can decide. Like if I take a CTG and if I'm sending you on mobile WhatsApp, okay, please guide me. So you cannot guide me, you know, because you don't know what is the condition, PA, PV, okay, what is the general condition. So it is combined decision of a patient and CTG together. Never any decision is taken only on CTG reading. Fine. So maternal observations, you will check temperature, blood pressure, pulse, any meconium is there, any like blood is there in the amniotic fluid, any vaginal bleed is there, patient is taking any medication, frequency, what is frequency of contraction, at what stage of labor the patient is, what is the progress of labor, parity, and fetal response to digital scalp stimulation. And if there had been an FBS, then that is also taken in account. This part no need to remember. This is just to understand that whenever you have to answer a question, it is combined. Finding general finding of mother, abdominal finding, vaginal finding, and CTG. So we have to take everything in account. Okay. So this was a bit theory. Now come to I'll be starting with very basic, you know. So usually you find a CTG trace, and there are two things are there. So we have to really look at paper speed. So either it will be 1 centimeter per minute or it will be 3 centimeter per minute. If it is 1 centimeter per minute, so this kind of trace you will get. And with 3, you can see this much you will get. This much, like everything will be very stretched. But in the exam, what we get is 1 centimeter per minute. So we will get this type of thing. Fine. So this is one basic thing. Apart from this, we have to know what is this 1 centimeter mean. So this is one big this is one box from here to here. So this is 1 centimeter. Okay. Now if we take smaller one, so it will be 30 seconds. So whenever we are seeing accelerations and decelerations, we have to really know what is 1 centimeter, what is 1 centimeter, what is 1 minute. So from here I cannot draw. So from here to here it will be 1 centimeter. Fine. Okay. So this is 1 centimeter. This is 1 centimeter. Coming to minutes, so this 1 centimeter will be equivalent to 1 minute. So this is 1 minute, and if we take half of it, so this will be 30 second. So if we take smallest square, so it will be 30 second in the horizontal axis. Okay, now what is vertical axis? This is vertical axis. Now you see, you will always find this type of marks. So this is 30 and this is 60. So so it will be 40 and 50. So one this square, so one this square is 10 beats per minute, because we have to find out how much dip is there when we do CTG. So we have to find out. Sometime this small square, it will be 5 beat per minute. So you have to calculate it from this reading. Okay, so now in this you can see this much is 10 beats per minute, 10 BPM. But in some other traces, you will find this as 5 beats per minute. No need to remember, just see this and you will be able to calculate. But as in the exam we get trace at 1 centimeter per minute, so this will be 1 minute, always 1 minute. So this calculation is important because this helps in interpretation of the traces. This thing is clear, people? This is clear?
Can you repeat again, please?
Clear.
Okay,
Clear,
I'll
ma'am.
repeat.
Clear, ma'am.
So we will get in the exam 1 centimeter per minute. So there will be these are the square. So now this is the horizontal axis. So from here till here it will be 1 minute. Okay, this is 1 minute, and half of this 1 minute will be 30 second. So if we take this from here till here, so you will find 10 centimeter block here. So from here to here it will be 10 centimeter or sorry 10 minute CTG. Okay, and now we have to all second calculation is beats per minute. So this vertical thing tells you beats per minute. Sometime it will be 5 beats per minute, sometime it will be 10 beats per minute. For example, here it is 10 beats per minute. Now this is why, calculate it, 30, 40, 50 and 60. So this is 10 beats. Okay, so this way calculation is done. Fine. And is it clear now? I think it should be clear.
Yes,
Ma'am,
ma'am.
Clear.
Clear,
the
ma'am.
horizontal
Yes,
square
ma'am.
is for 30 seconds.
30 second is this much, this much is 30 second. Okay,
Okay,
Yes.
thank you, doctor.
and now this is a trace from UK hospital. So why I have put it here, to show you this speech. So in the exam you will be getting this like so this is from UK, and now you can see this type here it is 80. So it will be 85, 90, 95, 100. So here it is 5 beats per minute, and this one square will be 1 minute. Okay, so here small square is 5 beats and this is always 1 minute. So from here till here, from here till here, so it is 10 centimeter. Fine, so this is 10 centimeter in between this. This is a real trace of the UK hospital. Okay, now come here. So when we calculate CTG, we have to calculate.
Hello, ma'am.
Yes.
Please. In the previous slide, there is two traces, and one has baseline heart rate of 140 beats per minute, and another one is a fade line showing heart rate of 80 beats per minute. Is it a twin CTG or not?
It's maternal. Maybe
Is it a
this is
maternal bus or twin CTG?
maybe it is a twin CTG. Yeah, maybe. Yeah,
This
we can see.
maternal pulse it is.
Maternal pulse. Ma'am.
In our hospital, there is no recording of the maternal bus and the CTG, but in this CTG, there are two lines in the CTG. One is heart rate is 140, and another one is heart rate is
It is a
about
maternal
baseline heart
pulse.
rate 80.
I was
Okay.
it is a maternal pulse.
Oh,
Look,
I have
okay.
never seen that maternal pulse in a CTG before.
Okay, in the
Eh,
exam, let me answer. Okay, in the exam also you will get only one thing, but if you find two traces, so at the this side there will be mark. Either it will be maternal pulse or they will mark it fetus 1 or fetus 2. Then in that situation you will be able to identify it. But it appears to be maternal pulse. Why? Because 80. So it will be maternal pulse. It cannot be
yes.
twin. So it is maternal pulse. So, but again, they will be marking because I have taken a very small piece of CTG this paper because I never had a big one. I just wanted to show you this much. Fine, but this is maternal pulse because 80 can be maternal pulse.
Oh,
Okay.
thank you very much.
The
Dr.
exam you
Priyata,
will not get.
can I
Yeah, yeah.
interrupt? It is written also the maternal heart rate 84/75. And few days back, I saw a CTG of from UK, some of the college. They had the maternal pulse like this. Some of the hospital takes the traces also.
Yeah, then
Oh,
it's
thank.
Maternal pulse.
so yeah, there are two things. It is 80, so it would should be maternal pulse. Second thing, they will be marking because in the exam you will get a complete CTG. Okay, I just wanted to show you 1 centimeter per minute. Therefore, I just put it. Okay, so when we calculate CTG, there are few things we calculate: baseline, variability, acceleration, deceleration, and contraction. So if you are able to read that, then uh, interpretation will be like easy. Okay. So now baseline. So what is the baseline? So baseline, when we have to calculate, we actually take 10 centimeter 10-minute strip or 10 centimeter strip, and usually we select the area where accelerations and decelerations are not there. This is average. This you have to remember because this question usually it comes in the exam, normal range. And the maximum mistake what happens is we do 100 here, but it is according to NICE it is normal. It is 110 to 160. Fine. How we will calculate it? So now like this is a quite broadened picture. So you can see this is the baseline, but how to calculate it? So if this is a CTG, so you take 10-minute window. So from here to here we can take 10-minute window. Now we will look it down. So we have to find a area where contraction is not there. That means uterus is a bit quiet. So this, you can see this area appears where uterus is quiet. So you can calculate baseline of this area. Now you can see it is coming near 120 only. Okay, so this is the basic principle because your acceleration and deceleration will depend on the right uh, uh, like calculation of baseline. Fine. So this is this way. So now this from here to here is 10 minutes. Then just see down where the area where no contraction is there, corresponding to that area you just see. So that area will give you baseline. Okay, so here this is 10 centimeter, this is 10-minute window, this is area where no contraction, corresponding to that area on the trace appears to be this, so this appears to be 120. So this way collection you can do calculation for baseline. Is the thing clear?
Clear.
Now this I just put, but it is not necessary for your exam because they never ask it. Only one thing you have to remember from here, that fetal tachycardia is more than 180. Okay, this we sorry, 160, this we already know. So these are the causes. If you any time like you find that baby tachycardia is there, then you have to find out what could be the reason. One thing is that maternal tachycardia. Okay, so if you get a trace on which maternal pulse is there, so you'll be able to find fetal hypoxia, any sepsis, choriomanitis, anemia, fetal heart problem, tachyarrhythmia, and gestational age. For example, at fetus less than 32 weeks of age, like tachycardia will be there because of immaturity of sympathetic system. Okay, so but in for part 2 or part 3 exam, no need to remember this table, just you listening that one will be enough. Okay, so fetal bradycardia when baseline rate is less than 100 beats per minute. Now what is acceleration? This definition, part 2 they're asking this, so you have to remember this. So increase in baseline 15 beats per minute, that means it should be more than 3 boxes, and it should be greater than 15 seconds. 15 seconds will mean one half of the small square. Okay, if that much is the acceleration, then only we will say it is significant. If we find acceleration, we already know that we are happy, our baby is doing great. But if you don't find, then also there will be no issues. Okay, now yes, I'm so this is acceleration. Now you can see, so here you can, this will be like baseline rate. So if you see, these are the accelerations. So now calculate 30 seconds, this will be like 1 minute, maybe 45 seconds. Okay, this is maybe 45 seconds, and it is more than 3 squares, so more than 15 beats. So it is more than 15 beats, and it is staying for nearing 45 seconds. So this is a significant acceleration. Because why? Because it fulfills our criteria or definition of acceleration. Okay, is it clear? So it is not very difficult here.
How did it calculate 45 seconds?
Okay, let me tell you. So it is, if this acceleration start from here, I don't know how to find out. Uh, so
Acceleration is a good sign, not bad sign.
yeah, so see here. So this acceleration start from here, and this ends here, and this one is like 30 seconds, because
So
this
around 90 seconds, right?
this is sorry, yeah, this is 1 minute. So this will be 1 minute, and this will be 30 seconds. Yeah, so it is like more than, not 45, it is more than 90 seconds, and it is more than 1 2 3 4 beats. So it is 4 beats means 20 beats per minute. So this fulfills our definition. So it is significant acceleration. Now it is clear.
Ma'am, this one small square is equivalent to how many seconds?
This is
30
30 seconds.
seconds.
Yes, this whole is 1 minute. This is 1 minute. Clear?
Okay. Yes, now it is
Yeah,
clear.
this is 1 minute. So this will be 30 seconds. Does it make sense now?
Yes, ma'am.
Okay. Now, okay, acceleration. Now, you see, so this acceleration is easy to calculate. Now, coming to variability. So, variability is beat to beat variation. That means how much variation is there from one beat to another beat. And if variability is the interaction between this chemoreceptors, baroreceptors, cardiac receptors. So if the variability is good, so we are happy baby's autonomic nervous system is doing great. Okay, and it is a good indicator for healthy fetus if the variability is good. So this I already told you. Normal variability is in between 5 to 25 beats per minute. Okay, so how we calculate it, so I will tell you that as well. So usually we take 1 centimeter strip and we calculate peak and flow, and then we can minus it off, then we will get variability, but I will explain it, don't worry. This is again directly from the NICE guideline, this you have to know. So if it is in between 5 to 25 beats per minute, we are happy. If it is less than 5 for 30 to 50 minutes, then we will say it is one non-reassuring feature. And if it is more than 25 for 15 to 25 minutes, then it is again non-reassuring. Abnormal will be if less than 5 for more than 50 minutes, and if more than 25 for more than 25 minutes, and sinusoidal. So these are abnormal. So for part 2 people, you have to remember that table of NICE guideline, everything, a day before you go to give exam, at least that 49 page number page NICE guideline, that table you have to like revise. Okay, less to explain here. Now I will just explain how to calculate it. Now, so this is the variability. Now I will just show a picture. So this is normal variability. So what actually we do, this is, now you already know, this is 1 minute strip. So we take 1 minute strip where acceleration or deceleration are not there. Then we calculate this, the lowest part of it here, and highest part of it. Then we can find out how much it is there, like we can calculate it from the boxes. Now we can see it will be 1 box and 2 box. So 1 box we know 5 beats per minute, so these are 2 boxes, so it will be 10 beats per minute variability. Okay, so this way we calculate variability. Okay, is the thing clear how to calculate variability?
Again, ma'am.
Okay, so we will take 1 minute trace where no acceleration, no deceleration is there. Then you can
sorry,
do,
Dr. Priya.
yeah.
That the box is 10, not 5, because
Okay, so then
from one to
yeah,
another.
yeah, that's fine. Then this variability is 20. Okay, so we take 1 minute strip. This is 1 minute strip. We take 1 minute strip when there is no acceleration and deceleration. Then we can just draw this kind of line, or we can just think in our head. Then we have to calculate how much boxes are there. Okay, so now here is 1 box and here is 2 box. So so in this CTG it is 80, 90, it is 10. 1 box is 10 beats, so here variability is 20. Okay, so if the variability is 20, we are very happy. Why? Because it is in our normal range. Okay, now if you see this kind of trace, so wherever you take, now we can take this much, this is 1 minute, so we can take this much. If we draw here and if we draw here 2 lines, so this will be half, this is coming half of this bigger square, or even less than this. So this is reduced variability less than 5 beats per minute. Okay, so this is reduced. Now you see if it is more than 25, so if you draw line here and if you draw line here, so it is crossing 1 2 3 4 5 boxes. Okay, so 5 boxes in this trace, it will be 50. So this is more than 25, so it is abnormal. Okay, but again that time criteria is there, and it is more than 25 beats per minute, it will be called as saltatory pattern. Okay, this is I found new from the internet, it is not there in the NICE guideline, but it is like you can remember just one word, maybe they ask in exam. Okay, again if you see this is a deceleration, and you will find there is no variability. variability is these oscillations. Okay, these are oscillations, but you see there are no oscillation here, no oscillation here, no oscillation here, so there is no variability. So this is very bad, you know. Okay, so this way calculation of variability is done. Any question about calculation of variability? Any question? No question. Okay. Okay, fine. Now again same thing in a like magnified manner. Somebody's mic is on, please. Okay. Sorry. So now this is the bigger picture. You can see this is the uh, like draw of it, or lowest part, this is highest part. So you have to calculate distance in between them. You'll be able to find variability. Fine. Again, now you see variability picture here. This is again they are calculating same thing. So if we calculate this kind of here, so it will be from here to here, and as this is again 10 so 60 70, so this is 10, so one square here is 10, so it is crossing two squares, so it is 20. Here it is again 20, but here it is like 10. But you know, a uniform variability cannot be there. Therefore there is a range. So normal is 5 to 25, so it is in between the range, so we are happy. Now where reduced variability happens, it will happen in fetal sleep. But fetal sleep variability should not last longer than 40 minutes. Okay, if it is more than that, that means something wrong is going on. Fetal acidosis under the effect of certain drug, prematurity, congenital heart abnormalities. These are the reason for reduced variability, but you people just listen it, and never they have asked in part 2 or 3. I have to just tell you these are the reasons for reduced variability. Now you can see variability is reduced. So if we like if we take 1 minute strip, so I put a line here, and if I put a line here and if I put a line here, so you know it will be less than half a square, so it is less than 5, less than 5, this variability is less than 5. So if the variability is less than 5, then it is reduced. Now you see in this trace there had been no oscillation at all, so there is no variability. Now so we have calculated heart rate, acceleration, variability. Okay, now we have moved to deceleration. This is the most important part, deceleration. So we already know there are 3 types of deceleration, and maximum time we are calculating this deceleration for the categorization of CTG. So what is deceleration? This definition is important because for part 2 people they ask question from this line. So if there is decrease in the from baseline fetal heart greater than 15 beats per minute, 15 beats per minute, and it is it stays for greater than 15 seconds, then if we call this is a significant deceleration. Now heart rate, so heart rate usually we already know is controlled by autonomic and somatic nervous system. So if hypoxic stress is there, baby is getting acidosis. So in adult, if that happens, we usually compensate it by change in depth and rate of respiration. But for baby, that is not there. So how the baby will tackle this hypoxic stress? There will be change, reduction in fetal heart to and then there will be deceleration. Okay, so this mechanism is different in adult and in the fetus, but you need not to remember all this stuff because they never ask in the exam. You have to you have to know how to calculate and how many types are there. So usually there will be 3 types of deceleration: early, late, and variable. So if it is early, it is due to head compression. If it is late, it is hypoxia, or it is acidosis, uteroplacental insufficiency. And if it is variable, that means something is coming and going. It is because of cord compression. Now, how is the early deceleration? In early deceleration, usually deceleration will start with the uterine contraction and it will end with a uterine contraction. Okay, usually it happens because of head compression or because of the increase in intracranial pressure. So it is baby's like mechanism. Okay, baby will show this kind of behavior, and when contraction starts, deceleration starts, and when the contraction resolves, that means head pressure goes off. So deceleration gets corrected by itself. These type of decelerations are considered physiological. These are not pathological. Okay, so if early decelerations are there, we are not worried. Now these are early decelerations. Usually this early deceleration, they appear as a mirror image of a contraction. So if you see here, so it usually start with the contraction. So here the deceleration is starting. So it starts with the contraction and its dip and its uterine contraction height, they will correspond with each other. And when contraction goes off, this will also goes off. So this is completely appears same, or these are called as a mirror image, okay, of contraction. Now you see these are early deceleration slide. So this is deceleration, okay, and this is contraction. Now if you see, if you draw a line from this peak and from, so it will coincide with it with here. So this is deceleration and early deceleration. Again, if you see it here, so this is contraction and this is deceleration, and it is peak is almost same. So these are the mirror images, and we are not worried about these kind because we just read it is physiological type of deceleration. Now it is a significant deceleration, so we can calculate that as well. So now if you calculate time, so it is 1 minute, and it is 15 30 seconds maybe. So it is more than 1 minute, so it is lasting more than 1 minute. And also it is 3 boxes means 30. Okay, so it is more than 15 beats and it is lasting more than 15 seconds. So it is a significant deceleration according to our definition, and as it is mirrors the uterine contraction, so it is early deceleration. Okay, so this is the early deceleration. And this is again, if you see again, this is again strategy trace. So now see, these are the contraction and these are the deceleration. So their tip will coincide, okay, this way. Now this is again UK, so you can see it is again 1 centimeter per minute. Fine. So these early deceleration is mirror image of contraction. Now again, this is on a trace. So if you see, these are the contraction, and if you see this deceleration, it is not that significant, but the peak is coinciding. This is significant deceleration, okay, and if you see its peak, these are coinciding. Again you see coinciding. So this is almost mirror image of a contraction. So with every contraction you are finding the deceleration, and it is just a mirror image of it. So it is early deceleration. Okay, is it clear, early deceleration?
Doctor, one more doubt I just wanted to ask. So, in early decelerations, is it compulsory that it happens with every contraction?
Sometimes may not be there, but usually it is there.
Okay.
Ma'am, in
I
the
will
CTG,
also add it about the time from the beginning of the deceleration until the nadir should be less than 15 seconds. Otherwise, this comparing with the variable sometime becoming as a mirror also.
Ma'am, the CTG shows the decelerations to be less than 15 beats. It should be more than 15 beats, correct?
Yeah, it should be more than 15 beats. So here it is 90, 100. So it is 10, 100, 110. So it is 10. One.
Okay. Oh yeah, it's 10. Okay.
Yeah.
Okay.
And someone said about this. So you know the like in early deceleration. So time of start of deceleration and time of its peak. Okay, it will be like less than 30 seconds. It is no, it is more than 30 seconds. So this is one type of picture is there, but you know, with this it is not always very easy to calculate. So this I never explained that way. Someone was asking this. Okay, but if you see like mirror image kind of thing and a tip coinciding type of thing, then answering becomes more easy. Now coming to variable deceleration. Okay, so variable deceleration, there is no they're inconsistent. Okay, in shape, in their frequency, in their size, and they will have in their relationship to contraction. So they're not related to anything. Okay, they can be of varying shape, there can be of different frequency, and they will not be related to uterine contraction. Okay, so these are variable contraction, and the most common deceleration that we find is a variable deceleration. And with the variable deceleration, it usually occurs because of cord compression. So on either side of deceleration, there will be there is a small increase in the baseline. These are shoulders. Okay, so this shouldering, uh, if it is present, then we are happy, because it demonstrates normal physiological response of cord compression. So like these are shoulders. Okay, so small rise in the like this fetal baseline rate before starting the contraction and after ending the contraction. These are the shoulders. So if they are present, so we are happy about it. So these are the shoulders that you have to know. Now if you have finding difficulty in calculation, so this is another kind of a definition is there, where what they say, from the onset of the contraction and to reach its peak, its time will be less than 30 seconds. Okay, it will be less than 30 seconds. For other deceleration, it was more than 30 seconds. For variable, it is less than 30 seconds. Okay, from here till here. Fine. Now why variable deceleration always occurs? Because of cord compression. So any issues with the cord, this type of deceleration will occur. So sometime it is around the neck, sometime there is a knot is there, sometime prolapse is there. Okay, so now these are variable, so these are contractions you can see, and you see this is deceleration, this is deceleration, this is deceleration, and this is deceleration. Now see, there is no every deceleration has got different shape, they have got different size, they have got different duration, and they are no relation, they have got no relation with this kind of contractions. So these are variable decelerations. Now on the CTG trace, these are now the this is,
Can I
yes,
interrupt? In the previous picture, the first one is an early deceleration.
which one?
The first one here in the same picture, doctor.
Yes.
The first one is early deceleration, it seems like.
Yeah, it is coinciding.
And the
Yeah,
rest is not related to contractions.
yeah,
Correct,
this
no?
is, yeah.
No, but the first one from the onset of deceleration to the trough, it is less than 30 seconds. No, that property, if we consider, it will not be early.
Yes,
Okay.
you are right. And you know, whoever is
Ma'am, would you
speaking,
explain the 30-second again?
so this is start of contraction, and this is like a peak of contraction. This, so it will be less than 30 second in variable deceleration. Okay, and it will be more in other two type of deceleration. Is it clear now? Now we see again. So this is start of contraction and this is dip. So if we draw a line here, so it will be less than 30 seconds. Fine. But that much calculation, when we do interpretation of CTG, you know, it will not be required. We'll be doing so many CTGs, so you will not have that problem. Okay. So usually it is a, and if you are, if it is, if you think it is an early deceleration, then we are more happy, because you know, early deceleration, if it is there, it is physiological, so we will not be worried about it. Now these are contractions, and see these this deceleration. So this, it has got different shape, it is different, size is different, this is again different. Okay, so not related to, this is again different. So you know, no same kind of pattern. So so they vary in everything. So these are variable deceleration. Okay,
Ma'am,
now
just 1 second. In variable decelerations, we were talking about shouldering. So in shouldering, is there any particular number of beats that it has to rise, or it is just a rise below it falls?
yes, just right. Like you can see, this is a shouldering.
Yes, yes.
This is a shouldering. I will show picture of shouldering also. Okay, and this is late deceleration. These late deceleration are, they are uniform in shape and depth. Okay, so you will find same kind of pattern after every contraction. There will be same kind of pattern. So these are uniform in shape and depth. Okay, this type of why this happens, we already know. This is because of hypoxia, less of blood supply is there through placenta, so it causes hypoxia and acidosis. So we are too much worried about late deceleration. So now you see late deceleration, usually late deceleration will start at the highest point of the contraction. Okay, so it will start after contraction, and it will come to normal once the contraction passes off. So so this is contraction, so it is started after that, and it come to normal after the contraction is over. Okay, so it comes to normal here, contraction becomes normal here, and this deceleration come to normal here. So this is late. Okay, and if we calculate onset of contraction and the peak of it, so this time, so see this will be more than 30 seconds, or more than or equal to 30 seconds. So in early deceleration, this part, it was less than 30 second, but in other type of deceleration, it is more than 30 seconds. Okay, so this is late deceleration.
Variable it is less.
Is it variable less than 30? Variable deceleration?
What I said, yeah, if variable is less than 30, other two are more than 30 seconds or equal to 30 seconds.
But here, Dr. Priyata, if we see here, how can we say that it is less than 30? It is two squares, no? Two small squares.
So
It is one small.
if you calculate this hair from this
Okay.
hair, so this will be this much.
All right, all right. So we have to go through one side only, right?
Yeah, but you know this.
We don't have to get.
Just wait. When we will be doing this CTG traces interpretation, this is not that much important, you know.
Okay. Thank you.
Maybe the CTG 1 centimeter per minute. Yeah, this may happen, you know, because I just copy a small picture of it, so I won't be able to tell whether it is 1 minute or 10 or 33 minutes CTG. Now causes, this is not just no need to remember this. So late deceleration, when it happened, you find some problem is there: abruption, maternal hypotension, excessive uterine activity. Like if chronic condition is going on in pregnancy, you are getting IUGR baby, like in this condition, or prematurity. Nobody will ask what are the causes of late deceleration. I just put it because I have to tell you. Now you see these are the late decelerations. So there is a pattern. So these are uniform in shape and in depth. Okay, the uniformity is there. Now this is the contraction. This is peak of contraction. So it will start after this. Okay, your contraction stops here, and the deceleration ends after contraction. So this kind of deceleration is late deceleration. Okay, so and this type of deceleration usually you will find with with every contraction, because this is because of hypoxia. Okay, so these are late decelerations. Now if you see this, so this is peak of contraction. Deceleration starts here and it ends here, and contraction already ended. So this deceleration is a late deceleration. So now you see they are uniform, they are almost uniform in their shape and depth. Okay, now this is again a late deceleration. So this is peak of contraction. Deceleration starts here, but it end here when the contraction is already passed off. This is again late deceleration. This is peak of contraction. Now see, here the deceleration started and it ends after the contraction. Contraction is already ended, then it ends. So this is late. This is late. Somebody's mic is on. All of you mute yourself, you know, somebody's mic is on. Okay, so you see there is a almost uniform kind. Now another feature that this you will get all maximum time you will get this in the exam. There will be single prolonged deceleration that has lasted more than 3 minutes, and if this feature is there, according to NICE guideline, it is abnormal CTG trace. What could be the reason? Some emergency had happened. Either there had been rupture, there had been cord prolapse, or there had been abruption. So if you find more prolonged deceleration more than 3 minutes, so you have to think of all this kind of emergency. Some emergency had happened. So if you find this, so rule of 3 you have to remember. For 3-minute bradycardia, so it will be call for help. Within 6 minutes you have to move this patient to theater. Within 9 minutes you have to prepare patient for assisted delivery. By 12 minutes you have to deliver this baby. So this is like rule of 3. If the bradycardia or prolonged deceleration is there for 3 minutes, because you see all these are emergency. So it is you have for both part 2 and part 3 people, you have to remember it, because this you will get in the exam. And for part 2 people, like if they give this type of CTG picture, and if they ask what is next step, so your answer will be call for help. Okay, and if they ask you more appropriate step, then answer will be expedition of delivery. So you have to all, this is a their like RCOG's game. Sometimes they will ask next step, sometimes ask. Yes,
Can you
what do
repeat
you
it
say?
again, ma'am? The most appropriate, what should be answer, ma'am?
Okay, okay, yeah. So if they have given this kind of CTG and they have asked you next step, answer will be call for help. Okay, because it is an emergency. But if they ask you what is most appropriate step, your answer will be expedition of delivery. Deliver the baby. Okay. Now the thing clear.
Yes, ma'am.
This
Yes,
you have
ma'am.
to,
Clear. Thank you.
And
this
think
you have to
there is one
remember.
more. Yeah, there is one more thing that they have added in the guideline, that if at 9 minutes the CTG is normalized, that is also one question was there. If
Yeah,
you're following this protocol rule of
yeah,
3 and at 9 minutes CTG was normal.
so you have to reassess. Yeah, that is just coming. This is CTG rule, sorry, this is from strategy rule of 3. So if you get question, you have to know this. But what you are saying, I'll be just explaining that as well. But rule of 3, if question come, you have to
Okay.
remember.
Okay, ma'am. Yeah.
Yeah, I will tell that also. So now this is, you see, these are the minute: 1 minute, 2 minute, 3 minute, 4 minute, 5 and 6. So this is a so big a deceleration, and this is lasting more than 3 minutes. So this is single prolonged deceleration. It is an abnormal feature, and CTG will be pathological. This is again C, so big deceleration. I'm not counting, you already know this is more than 3 minutes. Okay, so for part 3 people, this is very common trace they usually give. In their station, they will give you this kind of trace, and also they will give you one scenario. So actually, they want you to explain this to role player, and also you have to explain her about expedition of delivery. So this kind of trace, like it is very common for part 3 exam. It is a station. Now, what you have to remember is another thing is a sinusoidal pattern. So what happens in that? It is very smooth sine kind of wave, sine wave like thing is there. Usually variability is not there in these traces, and usually they will roam about somewhere 5 to 15. Okay, it indicates fetal hypoxia severe, anemia, or fetal maternal hemorrhage. So this theory is not important for you. Just you have to just see how it happens. So now you see, so this is sinusoidal CTG. So you see there it is sine wave like, and there is no variability at all, and it is in between 5 to 15 beats per minute. Okay, so it says it like fulfills all criteria. So it is sine wave like, it is smooth, it is undulating, there is no variability, and it is usually in between 5 to 15 beats. Okay, so this is sinusoidal type of CTG. Sometime part 2 people get this in the exam, so you have to identify it. And this is an abnormal feature, and so the CTG becomes pathological. This is again sinusoidal. Okay, so this is all about like teaching. Now some nice guideline
The
for CTG.
previous slide amplitude is more than 15, no?
See these kind, yeah, you are right. This kind of picture, these are not from clear CTG papers. This someone has drawn. just to make you people
Okay.
understand.
So it should be between 5 and
Yes.
15, correct?
Usually it is like that, but it is, anyone who doesn't know CTG will be able to identify this kind of picture. Okay.
Yeah, Dr. Priyata? Dr. Priyata?
Yes, yes,
Victoria,
yes.
ma'am? There is one question in July 19 about this sinusoidal pattern. And they ask the typical picture of sinusoidal like the previous picture. And they give all the type of infection. They give parvovirus, listeriosis, and all this infection. Which you want to choose here? Because some people, they go with listeriosis because sick meconium, and some go with parvovirus because there is anemia. Which one will you choose?
Parvovirus. Parvovirus.
Parvovirus.
Parvo
Now, severe fetal anemia.
with parvo.
Parvovirus. Yeah, it
Yeah.
is parvo. Okay, what parvovirus does? Usually, parvovirus it affects newly developed RBC cells. So, RBC cell is not developing inside fetus. So, baby will have severe anemia. Therefore, they show sign of high drops, and treatment is intrauterine transfusion. Okay, so all this explains severe fetal
Okay,
anemia.
thank you.
So, yeah, now you will never do this mistake. So if this kind of CTG is there, nothing but parvo.
Okay, ma'am.
Okay, so
Okay.
this, yeah, so these tables are killer usually, but we really can't help it. You have to remember this, that's all. So keep on reading it again and again, because you will be able to identify baseline, variability, acceleration, deceleration, but categorization will come from this table only. So I will try to like make you understand, but again you have to do it from guideline. So if the baseline is in between 110 to 160, we are happy. It is a reassuring feature. If the variability is in between 5 to 25, we are happy. So it is sorry. So it is in normal category. And deceleration, if early decelerations are there, and if variable decelerations are there, but these are less than 90 minutes. Okay, so we are happy, we need not to worry. And acceleration, if it is there, so that is a reassuring sign. But if acceleration is absent, then it's fine, no problem. Okay, so now if you in your CTG, you will find many times CTG and there will be variable decelerations, then no need to worry. So if the variable decelerations are there, but no features are there, and CTG is less than 90 minutes, then you will mark that as a reassuring. Fine. So this you have to remember, that's all. Now there are two types of question come. Sometimes they ask you feature, sometimes they ask you categorization. If they ask you feature, your answer will come from reassuring, non-reassuring, and abnormal. So these are the features. Okay, sometimes they will ask you categorization. If they ask you categorization, your answer will come from NSP. NSP is normal, suspicion, and pathological. This appears quite confusing. So therefore I made even mnemonic for myself, because I used to make mistake all the times. So if categorization, I will put under NSP. I will tell that as well. Okay, so this is feature. Many times you will do part two people do their question wrong, because they have asked categorization and you will tell feature. Sometimes they ask you feature and you answer from categorization. Okay, so this please read your question well.
So
Now
feature will
the
be for
what this is
individual. Sorry, ma'am. Yeah, so feature will be for individual. Like
feature
they
is,
ask you feature of deceleration, feature of baseline, like that.
yes,
And
yes, yes,
categorization will be
yeah,
for the whole CTG.
yes, yes. So reassuring, non-reassuring, and abnormal. So these are features. Okay, and okay, it will come late. Normal, suspicious, and pathological. These are categorization. But I'll explain you again everything. So this is now reassuring. These are the reassuring features. You have to remember that, you know. And now coming to non-reassuring features. So baseline 100 to 109 or 161 to 180. So if this baseline you get this, so you will mark as one NR feature. Variability, if it is less than 5 for 30 to 50 minutes, then only it is a variable NR feature. And if it is more than 25 for 15 to 25 minutes, then it is a NR feature. But most of the time, the traces you will get, so I have never seen in any exam traces with high variability. Okay, so always they will give traces with less variability. So you have to just see variability, and if it is less than 5, please don't panic. See that trace. If it is more than 30, okay, then only put it under NR feature. But if it is like 20-minute trace, variability is less than 5, then we can't put it under NR feature. So this part you have to understand very well. Okay. Whatever the CTG you will find, they will give sometime 20 minutes, sometime 30 minutes. So if they have given 20-minute CTG and you find baseline less than 5, then you cannot put that under NR feature. If they give you 30 or 40-minute CTG and your variability is less than 5, in that situation you will put that in NR feature. So please take care how much strip they have given, whether it is 20-minute, 30-minute, 40-minute. On the basis of that only you will be able to mark this. Okay, so this is important to see how much time trace they have given to you. Then coming to deceleration, this appears to be a bit clumsy and difficult thing to understand. Uh, like it is too, but it is not very difficult also. So if the variable decelerations are there, and if they are for more than 90 minutes, then it will be one feature. So we have just read reassuring. So if it is if they were for less than 9 minutes, we were not very we were happy with it. But if variable decelerations are there, they have got no feature, and they are for more than 90 minutes, then you will take this as a feature. Okay, this is number one. Number now there is always there is confusion occurs between this and this. So you see variable contract deceleration, and if they have feature, then you have to see. So see variable deceleration, then look for feature. Now if they have feature, so if they are less than 50% of the contraction, then and they are present more than 30 minutes, then you will take this as a NR feature, and this is totally opposite of it. So if it is more than 30 minutes of 50 minutes of the contraction, then you can tell it say it for more than 30 minutes. So it is basically it is vice versa. So if contract if they are less than 50% of contraction, then time will be more. To be a NR feature, they have to present for more than 30 minutes. And if they are present 50% of the contraction, so like contractions are more, so time will be less. So it will be less than 30 minutes. Okay, so this part you have to understand. For part 2 people, it is important. Why? Because you will get direct question from these lines. So if the contractions are less, time is more. Time is more than 30 minutes. If contractions are more, then time is less. So there is a opposite thing is there. More contraction, less time, less contraction, more time. Okay. So this you have to like
Ma'am,
understand.
how to count 50% contraction?
So in a trace you will find, so we will do that as well when the just now. So if you find like 4 contractions and if you find for 50% it has to be more than two deceleration, then it will be more than 50%. Okay, so you'll be able to find it from the trace. If it has to be like more than half number of contractions, then it will be more than 50%. Okay, but variable
In a
deceleration,
20 minutes CTG, ma'am, in a 20 minutes CTG,
so if in a 20-minute CTG there are 6 contraction, okay, suppose, so you have to have more than 3 deceleration to say that you have got more than 50% of contraction. Now the thing clear or not?
yes,
If it is
ma'am. Thank you.
exactly, if it is exactly 3,
Ma'am,
if it
this
is
is not
3,
clear.
then it is up to
50% of
50.
contraction. Can you explain again, ma'am? 50% of contraction.
Okay, I have to show some trace then.
Because we are doing mistake in the exam, Dictora. Priyata, about this one.
Okay, now you see, okay, you take 10-minute trace. Okay, so contraction is 1, 2, 3,
2.
and 4. Okay, these are 4 contractions.
Yes.
Fine. So
Yeah.
if more, so what is 50% of 4 is 2. Okay, so if more than 2 decelerations are there, then you will say more than 50% contraction you have deceleration. Are you getting? So here are 4
Yes.
contractions in 10 and 1 or 2 or 3 deceleration. So here deceleration present
This
more
more
than
than
50%.
Okay, ma'am, clear now.
Okay. Yeah.
Yes.
Ma'am, what would be the ma'am, what would be the baseline of the CTG which you showed right now?
You have to wait. I will ask you. Who are you speaking? You have to do that.
Sorry, ma'am. Myself, Amita, ma'am. I just couldn't know the baseline. Everything was.
Okay. I will tell you everything. There are so many traces. Now I'm just teaching. I will tell everything. Not an issue. Okay, so and these are late deceleration. So if late decelerations are there for less than 30 minutes, late deceleration less than 30 minutes, then it is a NR feature. Now it appears a bit difficult to understand, so you can, this I made a summary. So what are NR feature? So if we have got variable deceleration and no feature, so and if it is more than 90 minutes, then we will take it as an NR feature. This is number 1. Second number, if we have deceleration but these are less contraction, so time will be should be more than 30 minutes, then we will calculate this as 1 NR feature. And this is opposite. Okay, this is totally opposite. If it is present more, then if it is like it is present more than 50% of contraction, then time duration can be less. So for less than 30 minutes, it can be a NR feature. So these two things are totally like opposite. So less contraction, time is more contraction, time is less. Late
Ma'am, I want to
deceleration,
know
if it
one
is less.
thing.
Yes.
Sorry, ma'am. I
Yes,
want
yes.
to know. The
Yes.
trace is usually given to a 20 minutes trace, but here how will we calculate 90 minutes and those things? I couldn't
That will
understand
come.
that.
It will be written in the
Normally
scenario.
we have to read a 20-minute trace.
That will
Hello,
not
ma'am.
come to you in exam. Yes.
Okay.
Yes.
That will be in the scenario, I think. That scenario will be given where they will tell us the time duration and all.
They usually give 30-minute or 40-minute trace. Okay.
But in the question they can give in written format that it is the 90
Yeah.
minutes.
Written form they can give. Part 2 people written form they can give. This you have to remember only. I tried to make a summary to just keep in the head.
Ma'am,
Okay,
I'm
ma'am.
sorry
Thank
to
you.
interrupt
Thank
you.
you.
Hello.
Yeah. Now
Hello.
come to
Sorry
yes.
to interrupt you, ma'am. Yeah. If that is exactly the 50%, then where to keep that one? If there are two contractions and two variable decelerations, then how can we categorize it? How can we
Repeat
say
your
that, ma'am?
question. Repeat
If
your
the
question.
contraction, yeah, yes, ma'am. If the contractions are two contractions are there and two variable decelerations are there, that means it is exactly the 50% it will come. So then how can we say that one? Is it a
So that will be more. See, if it is two contraction and two deceleration, that will be 100%. So it will come with every. It will come this more than 50%.
Yeah, more than 50. I mean, if it is what is how can I say?
Actually, I
If it
understood.
is
Can I tell
exactly
you what?
exactly the 50%, exactly the 50% like that,
Okay.
then
See.
how can we say?
Okay.
It's
Madhu,
like a yeah.
Madhu, you keep the question with you. When we will do trace, then you ask that question again, or you will get answer by itself. Okay. Just
Okay.
wait.
Okay. Yeah. Thank you.
Yeah. Because without I'm just explaining you theoretical part. Without going to traces, your query will be explaining be a bit difficult for me. I have got 35 four or five traces. So you will understand. So now what is the abnormal feature? For baseline, it is more than 180 or less than 100. So this is one abnormal feature. If it is for variability, if it is less than 5, but we have to have a 50-minute trace to say it as an abnormal feature. Okay. So this part you have to remember very well, that if it is more than 25 for 25 more than 25 minutes, usually this kind you will not get. Sinusoidal I have already told. So any of these three things are there in variability, you will put one abnormal feature. Fine. Coming to deceleration. So if the variable decelerations with feature more than 30 minutes, here everything is more than 30 minutes. Okay. Late deceleration more than 30 minutes, uh, then you will put it under abnormal category. Acute bradycardia, everyone can understand. No, there will be no problem. So it is a summary of abnormal deceleration. So variable deceleration with features, or less. So it is for 30 minutes. Okay. And late deceleration for 30 minutes. It can be less than 30 minutes if any bleeding or any meconium is going on, and single prolonged deceleration. So if these things are there, then you will put it under abnormal deceleration category. Main problem happens whether it is a NR feature or whether it is a abnormal feature. It creates so much of even difficulty in my head as well. So I tried to simplify it. So if a variable deceleration with feature, if it is less than 30 minutes, it will be NR. If it is more than 30 minutes, it will be more than 30 minutes or 30 minutes, it will be abnormal. So just remember only one thing that will help you: variable deceleration with feature, less than 30 minute NR, more than 30 minute abnormal. Late deceleration, less than 30 minute NR, more than 30 minute abnormal. Because if you go to remember that table during the exam, it will create so much of mess. Which feature we have to put? See, there will be no problem with baseline, there will be no problem with variability. Problem happens with this deceleration only. So where what to put? So this way, if you can remember this, your answer will become easy. I'm repeating it again: variable deceleration less than 30 minute NR, more than 30 minute abnormal. Late deceleration less than 30 minute NR, more than 30 minute or 30 minute is abnormal. If you just remember basic thing of that, just put it in your head, then the most of the things will be easy. Now, what are these concerning features? If it is lasting more than 60 seconds, if there is reduced variability within deceleration, failure to return to baseline, W shape, no shouldering. So these are the characteristic features within variable deceleration. Now see, this is pure variable deceleration. You can see
Ma'am,
good
previous slide.
This is copy pasted from NICE guideline. Okay, I will show you these features. Fine. So this is good. This is variable deceleration. These are shoulders. So someone was asking shoulders. So these are shoulders. Okay, these are shoulders. Now this is delayed recovery, taking longer to recover to baseline. This is again delayed or slow recovery. Now see, there are no shoulders here. No, here a bit you can see, but here there is no shoulder. Here the W shape you can see. Okay, so these are variable deceleration.
Dr. Priyata, wherever there
Yes.
will be shouldering, so wherever there will be shouldering, that is not a feature, right? Concerning feature. That is a feature, but it is not a concerning feature, right?
If shoulders are there, that is good sign.
Yes. So we can say like we will not count it as a concerning feature.
No, if it is not there, no shouldering is bad. So here no shouldering is bad. This is a concerning feature to us. Now is clear.
Yes, yes.
No shouldering is bad. Okay. Now this is again same thing. Now see, deceleration are lasting for more than 60 seconds. So you see, this is deceleration, and you can see there is no variability inside the deceleration. Okay, these are bland kind of thing. So this is concerning feature. This is W shape. This is concerning feature. No shoulders. No shoulders. These are concerning feature. Delay return to baseline. This is concerning feature. If it is more than 60, it is this is also concerning feature. So these are the example, and this you have to remember. If it lasts more than 60 seconds, so this is one feature. Reduced variability inside the deceleration is a feature. Late return to baseline is a feature. W shape and shouldering is a feature. So these are the features. Okay.
Ma'am,
So
actually,
these
if
are
it
the
is
features
lasting,
we talk.
sorry, if it is lasting more than 60 seconds, then we cannot apply that 30 seconds rule, na? From the starting of contraction to peak, it is less than 30 because it's lasting more than 60 seconds.
You are confusing people, whatever who. So with this 30 second we calculate, okay, from here to here. Okay, so you see from the start to peak. So from the start to peak, it is less than 30. So it is variable. Okay, are you
Okay, so the
getting
recovery
who
is
was?
so the recovery is slower.
You can see this is the recovery. So it is taking more than one. So this is 1 minute. So it is taking more than 1 minute. Are you getting?
Yes, ma'am. Yes, ma'am. I got it.
Yeah. Now this is category. So if they ask category, you have to answer NSP. Just remember NSP. N is normal. All reassuring feature. We are happy. So either we can continue with
hello,
the
ma'am.
CTG. And
Please.
Yes.
One thing.
Yes.
If so, do you mean that the duration of the deceleration is counted only from the start of the deceleration to the peak only, isn't it? I'm not clear about that.
No. I'll tell you. Sometimes we make mistake whether it is a variable deceleration or whether it is a late deceleration. So we are not able to identify in that trace. So then to know whether we are dealing with early variable deceleration or late deceleration, then what we do, we take this from starting to this peak, and if this time from here to here, if it is less than 30, then it is variable deceleration, and if this time is more than 30 seconds or 30 seconds, then it will be late or early deceleration. So this helps in identification whether we are dealing which kind of deceleration. Okay, this is one type of thing. And when how much time it is deceleration is coming back to its baseline. Okay, so in if now if it is taking more than 60 seconds, so that means some feature, this is concerning feature, that means we are not happy with this baby. Now if you see this, then there will be this is 1 minute, so this is 1 minute, and this may be 15 seconds or more than it. So this deceleration from start to come to baseline taking more than 1 minute or 60 seconds. So it is a concerning feature. Is it clear now?
Clear, ma'am. Thanks a lot.
Now, normal, if all reassuring features are there, then either if we have got any indication to for CTG, so we will continue. Otherwise, we will put off CTG and we will start with the intermittent auscultation. For part 2 people, it is important to know, because sometime you will get an answer key, continuous CTG or intermittent auscultation. So then here you will get help. So in the beginning of the class, we just read indications for continuous CTG monitoring. If patient has got those indications, your answer will come to continuous CTG. But if patient has got no indication for continuous CTG, your answer will go to intermittent auscultation. Okay, so this is normal. Another, this will be suspicious. So if one NR feature is there, only one, then it will be suspicious CTG. So this much you have to do. So you have to think, this is from the NICE guideline only. So why it is there? You have got some suspicion. Okay, either uterine hypercontraction is there, hyperstimulation can be there, or any hypotension can be there. So you have to start with the, you have to examine patient, and you have to start with the conservative measures. Okay, and whatever you are doing, you have to do documentation, you have to keep always mother and birthing partner involved, and you have to ask for their like what they want, their wishes. Okay, so this you have to do. This is again from the guidelines, and you have to remember in the same hierarchy, because sometimes they will ask you what you do next. So answer will come from here only. Okay, so one NR feature, it is suspicious, and this is management for suspicious CTG. Now coming to pathological, so if one abnormal feature or two NR feature, so two NR or one abnormal feature, category will be pathological. Now this is the hierarchy from top to bottom. There could be acute event. Acute event, what can happen? It could be bleeding, prolapse, or uterine rupture. You have to think of uterine hyperstimulation and or hypotension as well. Start with conservative measure. So after starting with conservative measure, CTG is still pathological. Okay, then even you can go for fetal scalp stimulation. And if you find with the fetal scalp stimulation there is an acceleration, then that will be a good reassuring type of feature. Then but after fetal scalp stimulation also, if it is still pathological, then you have to consider fetal blood sampling. Here will be the catch: before you put answer as a fetal blood sampling, you have to see for dilatation. If it is more than 4 centimeter dilated, then only fetal blood sampling can be done. But if they have not given dilatation, or if it is less than 4 centimeter dilated and you have a pathological trace, then your answer will be expedition of the delivery. Okay, so here you will find maximum time From here you will get the answer. Okay, whether you have to do expedition of birth or whether you have to consider FBS, that will be done. That will be decide what type of proper vaginal finding they have given. So this is like management for pathological CTG, and you know it is a direct table same from the NICE guideline. But again you have to remember this table, because whatever they ask from this table, and they won't answer from here only. Okay, so again please remember categorization of CTG, it is NSP. So
Ma'am, can I ask a small question, please?
Yes.
Sorry to interrupt,
Yes, yes.
ma'am. Ma'am, can we do fetal blood sampling when the membranes are intact?
How you will do that? It is not possible.
Yes, ma'am, exactly. There was a
It is
question actually in some book regarding HIV. That's why I'm the membranes were intact and the CTG was suspicious. So I marked the answer as ARM, acute rupture of membrane, but the answer given was fetal blood sampling. That's why I'm asking, ma'am. So we
okay.
cannot
No,
do that till the membranes are ruptured.
no. How you will do? Have you not seen video of how fetal blood sampling is done? They put
So,
us.
ma'am,
They
actually,
put a
I
small.
know it. Yes, ma'am.
Yeah.
Hello.
I can share that. Yeah.
Yes, ma'am. Thank you, ma'am. I got it. Thank you, ma'am. I'll share that
Yeah.
question, ma'am, actually.
Ma'am, I have one
I
more
will
question. Ma'am, if it is less than
Mhm.
4 centimeters, like if it is 3 centimeters, then also we will not do fetal blood sampling. We will direct go for expedition of the delivery.
You have got no other option. HIV, hepatitis B, usually FBS is not done. It is contraindicated to avoid mother to baby transmission. Someone asked
Okay,
this
ma'am.
question.
It is a
Yeah.
relative contraindication, right?
Yeah, relative contraindication. Should not be done. Okay, so this is categorization. So please, when to choose fetal scalp stimulation. So okay, so if they say CTG was pathological and we have started conservative measures, but it is still pathological. So if they ask you next step, then your answer will be fetal scalp stimulation. Have I answered your question?
Yes, one of the questions before came ask about which one first you will do, offer digital fetal scalp stimulation or fetal blood sampling. What is
So
answer will be?
answer will be scalp stimulation. It is
Yes.
complete
This is
hierarchy. They
new.
are.
I think this is new in NICE guideline. Before, should we do fetal blood sampling?
Yes, you are right. This CTG, what the table what we are reading today, it has changed. It has newly come in 2017. It is updated. Previously,
Yes, because I
scalp
add this point. Yes.
yeah, previously it was fetal scalp stimulation was not there. It has been added after 2017. Okay.
Ma'am,
Thank you.
previous slide, please,
One
ma'am.
more
Previous
question,
slide.
Dr. Priyata, one more question here, please.
Yes.
When we say about the pathological CTG, and if they are asking for the next step, our answer will be scalp stimulation, right?
Yes.
No. So if they say first, what you will do first, then it will be conservative measures. If they
So we
say
have to go
after,
back again to the conservative measures. We will start with the conservative measures.
yes,
Next
first,
step, if it is appropriate, most appropriate.
yeah, for example, if you are dealing with cord prolapse, there is what you will do conservative.
That
You
is
have to.
expedition of the birth. No, if these features are ruled out, like prolapse, abruption, and the rupture uterus, otherwise this CTG is pathological, then we have to choose which one, because sometimes they will give this fetal scalp stimulation also, and this FBS also, conservative measures also. If it is next step, we have to go for conservative measures, or if it is appropriate step, then we have to go for scalp stimulation or FPS. Which one we have to choose?
Yes. So actually, their questions are clear. So if they ask next step, you have to answer conservative measures. Sometimes you will find they will say all conservative measures have been taken, still pathological. What is next step? Then your answer will be scalp stimulation. And if they say fetal scalp stimulation is showing no response or like anything, then you have to go for FPS. So this is complete hierarchy. Conservative, conservative measures first, then review CTG, still pathological, go for scalp stimulation. Scalp stimulation shows acceleration. You are happy, your patient, no worries. But if it is not showing acceleration or no response is there, then in the next step will be going for fetal blood sampling. This is the hierarchy they follow. Is it clear now?
Yes, thank you.
Yes. Then so you have to remember this NSP normal is all R feature and SS species is only 1 R NR feature. Pathological is 2 NR and 1 abnormal feature. Okay, so this you have to remember. Then if there had been a single if we there have been a single prolonged bradycardia, like we just saw many traces, then this will be the hierarchy. Top to bottom, they want all these step in the answer. So if they ask next step, it is seek urgent help. Okay, but if they ask most appropriate, then answer will come near expedition of the delivery. So this is the hierarchy. Okay, call for help. Then you if it is like, if you think it is hypotension or hyperstimulation, start with the conservative measures. You have to make a preparation for urgent birth, but you have to if this bradycardia persists for more than 99 minutes, then you have to do expedition. Like you have to deliver this baby by 12 minutes that we just read, 3 minute rule. But if at 9 minutes this fetal heart recovers, in that situation you have to discuss with you have to take a decision again. That means you have to review CTG again, and whether the expedition of birth is required or not. Then whatever you do, you have to talk to the patient. Okay. Now what are the conservative measures? Either you will change position, she can change any position but avoid spine position. If the patient is hypotensive, answer will be fluids. If the patient is on oxytocin, these are many questions come from here. If patient is on induction oxytocin, then your answer will be stop oxytocin, or your answer will be offering tocolytic. Tocolytic, like what they do is subcutaneous terbutaline 0.25 milligram. This number you have to remember, because usually they give this in their like in their answer stem. Okay, so these are the conservative measures. Now that's all about theory for CTG traces. After that we have to, there are so many traces for the interpretation. So anyone has got any question, or you want to go ahead with the interpretation?
Ma'am, one small doubt. So in the guideline, they have given one line like even if the variability is reduced, but there are accelerations, then it is a normal CTG. I did not understand that because I have not specified anything further than that.
Okay, in any trace, if you find any suspicious, any non-reassuring feature is there, but on the other side you are seeing acceleration, then we are happy, no need to do anything, baby is doing okay. If we
So
see
how long we can so any non-reassuring feature for how long, if as long as accelerations are there, it is no problem.
Yeah,
Is it like
as
that?
long Yeah, as long as you see acceleration, so no need to worry. No need to worry then. Okay.
Okay. So in any question, they'll give one non-reassuring feature and say then there is acceleration. Then we have to mark that answer as category normal.
But in that situation, there will be many other characters also. But like you have to give correct, like you have to comment on variability. You have to comment on like all other features. You have to comment. See, on the basis of that only categorization done. But if acceleration is there, that is reassuring feature. Okay.
But as a categorization for this patient, if she is having her variability is abnormal, so that not abnormal, or it is like variability is 5 less than 5, it is suspicious or non-reassuring. We cannot say it is normal, right? As if we have to categorize the CTG, we can say it is suspicious if all other features are normal.
See, for variability, if it is less than 5 and if it is more than 30 minutes, then only you can say it is a suspicious feature.
Otherwise, we cannot comment, right?
Otherwise, otherwise you cannot comment on that feature. You will take that as a normal feature.
Okay, okay, yes.
Okay.
Thank you.
This will be clear from the tray. Okay.
Ma'am, excuse me. So in features, we have 3 columns. One is the heart rate, another is the variability, another is third thing is the decelerations. So to declare it as a non-reassuring, all 3 should be there, or each individual can be counted as one?
I think we should go for traces. Many of the answer will be done. Just wait. You do traces.
That's why she was asking the question like that the variability is abnormal, but the acceleration was there. So these 2 features are in non-reassuring is there. So all 3 should be there. That was my question actually. Okay.
No.
The 3 parts are there in each feature. So all 3 parts should be there in a feature to declare it as a non-reassure, or even one part is abnormal, we will tell it as a non-reassure.
So that will be non-reassuring feature. But categorization will depend upon how many R feature, NR feature, or abnormal feature. You are just
categorization simple, yeah. Categorization clear cut. But I have doubt in features.
Even one component is non-reassuring is non-reassuring. We
Even one
need not
component
take
we
all
call
the
it as a
components.
non-reassuring.
Yeah, yeah.
If one non-reassuring feature, so you will put that under suspicious. Okay.
Okay, yes.
Okay, so now so now one person has to take one question. So who will take this? You read this?
Can I take?
Who wants one person to one time? Okay.
I can take, ma'am.
Anyone can take. Okay. So this is now.
Yes, ma'am.
Okay. I think first I should explain. Or Vishnu Priya is sitting. Vishnu Priya, do you want to do first question? Do this.
Yes.
Ma'am, please show the question, please.
Okay, but this question makes no sense because we are. I will not ask management. I will ask interpretation of the scan. Okay. Just see that as well. Not an issue. Okay. Because I am not asking management. Therefore, this question makes no sense here. But I put it. So this is the trace. Actually, today we are doing traces only, traces. So Vishnu Priya, you have to tell me trace. Okay.
Yeah.
Yeah, this is a CTG which is showing the baseline of around 140 to 140 with
170.
Yeah, one person, only one person will do. Okay, otherwise they will be confused. I have got many traces, so I will be able to give chances, you know. So Vishnu Priya, what is baseline?
yeah, the baseline here is where it is touching the maximum beats is around 160 to 170, I can say 160.
Very good.
160.
So
Around
yeah,
160 is the baseline, and
so
yes,
this is so this is the
yeah, 160.
Yeah, it is more than 160, so you can put it here. It is
160
here.
to 170.
So yeah, because these are the contractions. Okay, so
contractions. Yes.
You have to take this the part of the CTG where there are no contractions. So if you see there is no contraction, so you can say this. Okay, so this is the baseline basically. Okay, so this is 160 and it is more than that. So it is more than 160. This is fine. How many contractions in 10 minutes, Vishnu Priya? This is 10-minute
So
trace.
that is around 4 contractions, I can see. 3 to 4 contractions. 3 to 4 contractions.
Comment on acceleration.
As the baseline is 170 here, there is no accelerations actually. There are decelerations we can see.
No acceleration. Okay.
No accelerations. There is nothing above 170.
So now
All the
comment on
bits.
deceleration. So what type of deceleration?
Yeah. Decelerations we have early. I can say these are variable decelerations.
Yes, these are variable deceleration because you know
there is shouldering.
These are variable deceleration because every deceleration is different. There is
deceleration is different.
Every deceleration is different. Okay, so
and
it is
delay in
variable.
recovery. Yes, and
Yes,
delay in recovery.
Yeah, delay in recovery is 1 minute, and this is 2 minutes. So they are taking 2 minutes, and there is so much big fall in baseline. Okay, so deep
and loss of variability within the deceleration. Loss of variability.
Yeah, very good. So you have got variable deceleration.
With
W is also there.
W shape is there. Shouldering in one. Yeah. In few deceleration, shouldering we can see, and in few we cannot see. So shouldering, loss of shouldering, we can say.
You have got or you already got two features.
Other concerning features, yes.
So these are variable deceleration concerning feature. So if you take 10 minutes, so 1, 2, 3, 4 contractions, and how many deceleration? 1, 2,
so almost
3, 4.
More than
Almost, so it is
50%. More than 50% in 10 minutes.
So now you have got variable deceleration with features.
Yes.
Okay. So we have got trace for 10 minutes and this 10 minutes. 20-minute trace. Actually, we don't have so we have got 20-minute trace. So we have got variable deceleration with a feature less than 30 minutes. So where you will place it? Which feature? This will be
a abnormal feature.
For abnormal feature, Vishnu Priya, it has to be more than 30 minutes. Okay, less than 30 NR, more than 30 abnormal.
Yeah, this is NR feature. NR feature because this is less than 30 minutes. More than 50% contraction, less than 30 minutes trace. It's an NR feature.
One NR. So you have got one NR feature, and you have got baseline more than 160. So you have got two NR feature. Okay.
Two NR features. Yes.
So 2 NR feature means CTG becomes what?
Pathological.
Very good. Okay, so people now come here. So actually whenever answer is given, so answer is given in D bravado. So this is D bravado. D is determined risk. So in this patient, it is less than, I think, less than 35 weeks or more. So they are saying it is preterm. So it is a risk. Contraction 3 to 4. Baseline 162. Yes, NR is non-reassuring. So baseline is 162. So this is 1 NR. There is no acceleration. Variability, Vishnu Priya, you missed explaining. But variability, if you see this part, so it is more than 5. Okay, it is at least carrying, going more than 2 boxes. So it has got variability. Loss of variability here, but here variability is 5. So variability more than 5. Decelerations are variable with character. They have got delay return, loss of variability within deceleration, present more than 50% of contraction, and it is less than 30 minutes. So it is 1 NR feature. So now we got 2 NR feature. So overall impression is pathological. So, okay, so this way we have to do CTG answer. Fine. Please explain baseline. Okay, how we do baseline? This is not a very good trace for explaining baseline. I will do it in any other trace again. Okay.
Ma'am,
Now
any of the concerning features, even if one concerning feature is there, we take it as with concerning features.
Yes. Only one is there. We are concerned. We will take it as a concerning feature. Like if I see loss of variability, I will not look for any other feature also.
And with shouldering, if shouldering is there along with that.
But
shouldering will not be there. Usually shouldering will not be there. If loss of variability, how shouldering can be there? Usually it will not be there. So if you find one concerning feature, just put it under concerning feature. Okay.
Yes, ma'am.
Okay, now Vishnu Priya, I think you joined the class late. So if you this slide is important, everyone has to keep in the head. If variable deceleration with feature less than 30-minute NR, more than 30-minute abnormal, late deceleration.
Ma'am, I'm sorry to disturb you. Even the abnormal also, they're less than 30 minutes only, madam. Only thing is, risk factors will be there in the abnormal, I think. Even you wrote that for 30 minutes or less than with risk factors, ma'am.
Yeah.
It's not more than.
No, it will be less than 30 minutes if the risk factors are there.
Yes,
like
ma'am.
any is there,
Yeah.
any meconium is there. Okay, so that will be important if you are doing management part of the CTG. But actually we do make confusion here when we do put what type of traces are there. So this will be a sort of a mnemonic to keep in the head. Okay, that risk factor you have to always keep in mind if you are doing overall picture. Fine, but for categorization, this will be okay. With this, you'll be able to do. So if variable less than 30 minutes, put it under NR feature. More than 30 minutes or 30 minutes, it will be abnormal feature. Late deceleration, less than 30 minute NR, more than 30 minute abnormal. Okay, in the abnormal category, though everything has to be more than 30 or 30 minutes more to put in an NR. But if you have got a bleeding patient, if meconium is there, then then less than 30 minutes will be an abnormal feature. This only, Madhu, you wanted to ask.
Yes, ma'am.
Okay, so for just I put it here just because there occurs confusion when you do CTG question. Just if you remember this, then it will be easy to do that. Less than 30 NR, more than 30 abnormal. Now this is the who will do this trace? One person.
Can I try, ma'am?
Can I, ma'am?
Yes.
Can I?
I have got enough traces. Everyone will be able to do. You can write who wants. One person keep on writing here. So now who is writing? Who is doing?
Yes, ma'am.
Dr. Tanya. Dr. Tanya, you do this.
Yes, ma'am. Yes, ma'am. Here, baseline fetal heart rate is near to 160, 160 average.
Okay.
And in 10 minutes, there is 1, 2, 3, 4, 5 contraction.
Yes.
And there is deceleration and W pattern concerning features present. That means 2 non-reassuring features.
No, that tell me what are 2 non-reassuring features?
One is baseline fetal heart rate is
Baseline fetal heart rate 160 is there, but 160 is normal.
normal. Yes, this is normal.
So we have got only one feature.
Baseline variability is.
So variability from here, if you take here, it will be more than 5.
More than 5, yes, ma'am. That means
Okay.
normal.
Variability is fine because you take here and here, so it will cross more than one box, more than one
more
box.
Than 5.
One box it will cross.
And
So
deceleration, deceleration with concerning features, that means W pattern, is persistent more than 50% of contraction.
And it is for less than how many time is there? So it is less than 30 minutes.
Yes, less than 30 minutes.
So less than 30 minutes, you will put which category?
Yeah.
Less than 30.
With concerning features.
Less than 30, where we are there, less than 30?
With features more than 50, less than 30. NR, non-reassuring.
Okay. So we
Yes.
have got one NR feature. So feature, we have got one NR feature. So categorization of CTG is? With one NR, categorization is?
Suspicious.
Suspicious.
Yes, suspicious. Fine. So good. So you were doing this trace. Now see the answer. So this is contractions are 4 to 5. Baseline rate you said rightly it is 160. Acceleration not there. Variability like what I wrote is less than 5. But it is less than 30 minutes. Okay.
Ma'am, how will you calculate the variability?
So actually you joined class late or what? So we take
Yes,
this. Yeah, we take this. Then we put one line here and one line here. So the boxes in between them we count. That will tell variability. This is not a good trace to teach variability. Okay, so either you can take this 5 or less than 5, but on the other side this variability, if it is we take this less than 5, then it has to be more than 30 minutes for a NR feature. But here we have got only 20-minute trace, so we cannot put it under NR feature. Okay, though it is appears to be less than 5, but as it is less than 5 for 30 minutes, so we will not put under NR feature. So in this particular trace, because we have got almost 20 or 25-minute trace, so we have got only one NR feature, that is variable deceleration, that is W shape, W shape is there, and also like here it is going more than 1 minute. So it has a concerning feature, and it is less than 30 minutes. So it is NR and it is suspicious CTG. Okay.
Hello, Doctora,
Yeah.
please.
Yes, ma'am.
Hello,
Yeah.
Doctora? Yeah, please, for part 3, I mean, like this question, for example, this one last example you told, how it will be the question on this? The question can be what is the management next step, or what you can interpret the CTG. What kind of question?
Okay. For part 3, somebody's mic is on. Please mute. For part 3, two type of question come. Either they will give you CTG trace and they will ask you to do interpretation. So interpretation you have to do C bravado. Okay, then they will ask you management. They will give you some scenario. So then they will ask you management how you will manage. So this could be viva station, and sometime role player station will come. This patient will be in labor. They will give you one CTG. You have to do interpretation of CTG yourself, and you have to explain that finding to role player. According to that, you have to explain her what would be the management. Okay.
Okay, for example, this CTG last example, the one suspicious, like this one, what can be the management? Like this CTG, I will wait more 30 minutes, for example, she's contracting and already you defined it as suspicious.
See, for suspicious CTG, according to our NICE guideline table, we have to do conservative management. So you have to explain all conservative management. Okay.
Okay, okay. Thank
Answer
you.
management part will come from NICE only. So I think Ankita is next in the loop. Ankita.
Yes, ma'am. I'll answer. Yes, ma'am.
Yeah, I have got 35 traces. Okay, so everyone will get chance. After that, I have got part 2 question. So everyone will be able to do it. So don't worry. So
Yes, ma'am.
okay, Ankita, do.
Yes, ma'am. First, I'll do the contractions. 1, 2, 3, 4. Ma'am, there are 4 to 5 contractions in 10 minutes. Hello?
Yeah, I'm listening.
Yes,
More
ma'am. There
than
are 4 to 5 contractions in 10 minutes. And the baseline is near about 170, ma'am.
Yeah.
Baseline is 170. And the
Yeah.
variability is good. Variability is more than 5.
Yeah. Good.
And there are no accelerations. And now
Yes.
coming to decelerations, peak. Ma'am, they are not variable decelerations. They don't have any relationship with the contractions.
Very good.
So they are variable decelerations, and yes, W shape is there, and there is loss of variability while the patient is decelerating. So it's a concerning feature, and yes, it is more than 1 minute. So it is also a concerning feature. So basically, there is one and the contractions, this traces for 10, 20 minutes traces there. It's not a 30 minutes trace. So yes, we have a variable decelerations with concerning features for more than 50% of the contractions, but less than 30 minutes. So it is a non-reassuring feature, ma'am. There is a one non-reassuring feature only. So it's a suspicious CTG.
Madam, what about tachycardia? 170,
170.
But ma'am, 170 is more than 15 minutes. Yes, ma'am, it's a pathological. There is no NR, 2 NR feature.
Very good, excellent. Now
Yes,
you
2
see
NR
here.
feature.
So this patient is on oxytocin basically. So contractions are 5 to 6. Baseline, you rightly said it is 170. Acceleration not there. Variability is more than 5. Deceleration, variable deceleration with features. These are all features, but they are less than 30 minutes. Less than 30 minutes. So there are 2 NRPs, one is pathological. So you did it right. Please mute yourself. Okay, who was the next to do? Sujata or what?
Myself.
40.
Who is
Can I read the question?
Sujata?
Yes, madam.
Okay, Sujata,
Can I
you
read
can do
the
this.
question? Okay. This is we don't know the risk. I don't know the question. And coming to the contractions, there are no active contractions. And coming to the
Okay, you
base.
have to read the question. Please read the question. It is important.
Okay. It's a 40-year-old at 41 weeks of gestation, like oxytocin drip, fully dilated, head 1/5 palpable per abdomen. Occiput with caput is there, molding is there, and she's para 1, and she's been breathing for 1 hour. And previous years for a abnormal CTG. Contraction is now gone off. Oh, and there is a bloodstained lighter, and so it is like a rupture, no?
Meena,
Okay,
it is not antenatal. Meena, it is not antenatal. Okay. Now you have to tell me findings.
So the risk factor is now she stopped contracting with that. So now you can suspect of a rupture of the uterus with the contraction. There's no contraction now. She's lost her contraction because of the rupture must be. And then baseline heart rate is tachycardia because there's no contraction. You can take the longest period and must be here around 170 of baseline heart rate of around 170. And then Dr. Zebra variable accelerations, there are no acceleration. And then you have the decelerations. You have this is how many, this is for 10 20 around 30 minutes trace, and then you have 1 2 3 4, and then there is a prolonged deceleration not reaching the this thing. So this is anyway abnormal trace only, and there is lots of variability in between this thing in the variable deceleration, and it is not, there is no shouldering. So there are many concerning features also. So this is a abnormal trace.
Okay.
It is not coming back to the baseline also. It's just
Yeah,
so
that is very right. So you have to tell me how many NR feature or abnormal feature. Then you have to do categorization. So tell me feature. First you, yeah.
okay, features like it is this thing variable deceleration with concerns, and then there is a single prolonged deceleration, and the decelerations are lasting also, and there is one more deceleration which is lasting for 1.5, almost 2 minutes. So
Sujata,
that is there.
you have to tell
Huh?
me single what you will do. You will tell me this is single prolonged deceleration more than 3 minutes.
Yes, yes.
So
More
you
than
will.
3 minutes.
So it is a abnormal feature.
Okay.
And if
And
one abnormal
and
feature
it is
is there,
dipping to more than around 60, even before that around 80, and then even below 60 it's going. So it is a prolonged deceleration is there.
so what will be the categorize? So this is abnormal feature, and what is categorization? Quick categorize.
Pathological.
Very good. So this risk patient was on oxytocin and she is previous cesarean. It has got no contraction because already rupture is there. So baseline rate is like 160 or even slightly more than that. Okay, so this is 160. So here is maybe slightly more than 160 baseline rate. Acceleration not there. Variability like it is less, but it is for less than 30 minutes. So like we will not comment. But single prolonged deceleration is there. It is there for 3.5 minutes. So it is abnormal feature. So in your exam part 2 people, if they give trace and they ask for feature, so you will say one abnormal feature. But if they ask what is the category, your answer will be pathological. Okay. Who is next in the line to do?
Okay, ma'am. I'll take it. Dr. Nikita.
Nitika. Okay, Nitika. Okay, not a very good trace for you, but yeah, try.
Okay. For defining the risk, can I read the question, please? The 20-year-old para 1 with previous nausea, vomiting, diarrhea was induced for fetal growth restriction at 33 weeks of gestation with prolonged rupture of membranes, possible chorioamnitis. The woman is on oxytocin drip, 7 centimeter dilated, and the fetus is in OA position. Her temperature is 38.5 and she is on intravenous antibiotics. So for the risk features will be FGR, preterm, prolonged rupture of membranes, possible chorioamnitis, and she's febrile, 38.5. So then going to the contractions in there are about 3 to 4 contractions in 10 minutes. And the baseline is at 160, and variability
It is this is 160. Okay. It
yeah,
is going
baseline
above.
is 160, and there are no accelerations. The variability is 5. Yeah, it is 5 and below 5 sometimes, but not more than 50 minutes. So yeah, and then there are no accelerations and there are no decelerations.
So how many NR feature you have?
Yeah, there is reduced variability, but it is not for more than 50 minutes.
Yeah, so that you will not take. So
Yeah.
but baseline is more than 160. Okay, it is more than 160. So
Okay,
this is
then that's
only
one non-reassuring. So overall, it will be a suspicious.
Yes, overall it will be a suspicious. So now you can, if you see this question, this patient has got chorioamnitis. Okay, temperature is high. She's on oxytocin drip. So
Yes.
this is suspicious. So what you will do? You will start. You will yeah, it can start with the preterm also, reduce variability. Okay, so so you will give her paracetamol. If she's dehydrated, you will give her fluid. You will give her she's already on antibiotic. You will give her stop oxytocin. So you will do all these conservative measure. Then you will review this woman again. Maybe she will improve. Okay, so this is the conservative measures.
Yes,
Okay, who
ma'am.
is next? Yeah, okay, good. Next. Who is
Can I?
doing?
Me?
Yeah.
Yeah.
Asima, you can do. Everyone will get a chance. Not an issue. Asima,
Okay.
do.
Thank you. Yeah. Here, if we see contractions in 10 minutes, it will be around 1, 2, and around 2 contractions.
No. This is you will take this from here to here.
Okay, 1, 2, 3, 4 contractions.
4 contractions, yeah.
Yeah. Then baseline is around 130.
Very good.
And variability is around less than 5.
No, here one box is 10 beats. One box is 10. Okay.
Okay, it is normal.
So it is normal.
Yes, it is normal. So there are no accelerations and no decelerations also.
Yeah, so very good.
So it is it is all normal. It's a normal CTG.
So this is normal. Now you see the contractions are 4 to 5. Baseline is 130. Now you can see this is 120. And so this is going here. So this is 130. No acceleration, no deceleration. Variability is more than 5. Why? Because this one box, whole box is for 10 beats.
10 beats.
So yeah, and this variability is going for half box at least. it is more than 5. So this is a normal trace. Okay.
Do we call this acceleration or not, the first one?
This one, like it has to be more than 15 beats. So 1 and 2, yeah, this is 20 beats, and it has to be more than 15 seconds. So it is half. Yeah, we can say this as acceleration because it is more than 20 beats per minute, and also it is more than 15 seconds. Okay, it is staying like maybe 30, we can say this as an acceleration. Fine. Yeah, we can. So who is next?
Me?
Yeah, yeah, you can do. What's your name?
Latte new.
Difficult
And
name. Okay.
this is this is the intrapartum CTG. In this CTG, baseline heart rate is 110 beats per minute, and variability is about 10 beats, 5 to 10 beats per minute, and there are accelerations present. But in the later 1/4 of the CTG, there is loss of the tracings, maybe due to loss of contact, and uterine contraction is 3 in 10 minutes.
Okay, yeah, good.
And so my comment is normal CTG.
Very good, excellent. So this is 10 minute. Okay. Someone who wanted to ask how to calculate baseline. So for calculating baseline, we take 10-minute trace. Then we see the part of the CTG where contractions are not there. For example, this is 10-minute trace. This is the part of CTG where there are no contraction. So if we take the same part here, so then because here the baseline will be a stable baseline. So we will calculate it here. So this will be should be free from acceleration and deceleration. So ideally when we calculate baseline, there should be no contraction, there should be no acceleration and deceleration, and we calculate here. So we take 10-minute trace to calculate. If we see here, so here baseline will go here. So this way calculation of baseline is done. And how variability calculation is done? So this oscillation is variability. So if we have to calculate this, so we will take upper end of this and lower end of this. So this is the variability. So this is more than one box. If we see box here, so the one box is 70, 80. So one box here is 10. So if it is more than one box, it will be more than 10. Okay, it will be more than 10. So this we are happy with the variability, because any variability more than 5, we have got no issues. Okay, so this way we calculate variability. So you have done it very well. So it has got like 10 minutes, you can say 2 to 3 contraction. Baseline, this is 120, so this is the baseline. This is 110. Acceleration, yeah, these are acceleration there. Variability, we are happy, more than 5. No deceleration, overall normal. Who wants to do next?
Assalamu alaikum.
Yes, now, yeah.
Yeah, I will answer. Can you give me a scenario or history?
Scenario is not there, only traces.
Yeah.
You have to
Yeah.
tell me.
Yeah, this is a CTG of less than 30 minutes. Baseline within 135. There is 2 to 3 contraction per 10 minutes. 3 contraction per 10 minutes. And there is acceleration, no deceleration. Overall normal variability more than 5 to 10, even 15. And overall CTG, normal CTG.
Good. So So here it is a 10-minute race, and if you see here no contraction, so baseline goes here, so it is 130. So so baseline is 130. Acceleration, you can take this as a acceleration, okay, and variability is definitely it is more than 5. If you see here variability from here till here, so it is more than 5, okay, and deceleration, there had been no deceleration, so it is a normal CTG. Categorization is normal. And you next person.
Ma'am, may I try?
Yeah. So Amita, now you understood how to calculate baseline and variability.
Yes, ma'am. It's very clear.
Yes.
Ma'am, they are one.
Yes.
Ma'am, there are 2 contractions in 10 minutes, and
Yes. Okay.
the baseline is 100 beats per minute, and 100 to 110 beats per minute, and there are no accelerations. There are accelerations. There are accelerations, and there are no decelerations. And variability is more than 5 beats per minute. So variability is normal. The only thing is the baseline is 110. So baseline is
but 110 is okay.
So it's a normal CTG.
Yes. So if the baseline is less than 110, then
it will
it
become
will be called
suspicious.
that NR feature. So this has got no NR feature. Okay. So contractions are 2. Baseline is like 110. Acceleration, you can say, basically these are not these are like more than 15 beats are there, but maybe these are less than for 15 seconds. Okay. Variability is more than 5. No deceleration at all. So this is no feature. Abnormal feature is or NR feature, so it goes for normal trace.
Actually, it was looking like reduced variability for me.
In acceleration?
No, variability. The variability was looking like it is reduced, though it is not like for more than 50 minutes, however.
Okay, so variability, okay, if you take this one here, no contraction, so this and this, okay, so here it is 30, 40,
10.
50, so this is 10, but if you draw one line here and one line here, so this will be like more than half box, so it is more than 5. Is it clear?
What I was looking is somewhere on the more of the right side. Yeah, more, yeah, the little bit more right side after the contraction, after that contraction. Yeah, that was looking less than 5 to me.
Okay, if you say
Excuse me, I think Victoria, in the one now you are putting the arrow, there is I think one box. This one, yeah, it is one box.
Yeah.
I think this is 10 minutes. 10. It is more than 10 now, or 10
so
exactly.
Calculate here.
And the duration of CTG is also mentioned.
See, it has to be half box. If it is more than half box, then it is normal here. So it will be half box at least, you know. Half box is there.
Okay, ma'am.
And even after the last contraction, there is one also. One box is there also more than half. I think it is normal. Last contraction.
Yeah, this is normal.
Yeah.
Okay, who is next?
I can read.
Ma'am, shall I?
Dr. Noza, yeah. Anyone
Hello?
can do.
Yeah.
Yeah.
Yes, please. For this patient, there is contraction 2 in 10 minutes. This is CTG intrapartum more than less than 30 minutes. There is contraction 2 to 3 per 10 minutes. And there is baseline is 120 exactly. And there is acceleration. And there is also variability. No deceleration. Overall assessment, this normal CTG also.
Very good. So contractions are, if we take 10-minute race, so there are 2 contractions. Baseline, like here there is no contraction is there. So if I take this part, so here will be the baseline. Yeah, so it will be like 100, more than 100. So here it may be 110. Okay, you can take 110 to 120, so it's fine.
Yes.
Acceleration, we are happy. Acceleration, it is 1 acceleration, 2 acceleration. Variability, surely it is more than 5. No deceleration, normal. Very good. Who wants to do next? Who wants to do next? Yeah. Yeah, yes. Yes, who is doing?
It's okay, I can take. If no one?
5 contractions
No,
in...
Ramaya.
Okay. Yeah, she's taking. Okay.
Ramya.
5 contractions in 10 minutes, ma'am. Baseline is
5.
Baseline is 190 to 200, ma'am.
Yes.
200.
Mm-hmm.
Variability, it is 190. 200. Variability is okay, ma'am. It is 5 beats.
Variability,
Slightly
not okay.
reduced.
Less than 5 is there.
It is less than 5.
Yeah, it is less than 5.
Less than 5, okay. No accelerations, ma'am.
Yes.
And there is no decelerations also. There is one
So,
deceleration.
You have to tell me how many NR feature or abnormal feature.
3 abnormal.
3 abnormal. Tell me which.
Tachycardia. So 2 NR, it is pathological trace, ma'am. 2
It's 3.
No. Who is saying 3? So please tell me 3 NR feature.
For baseline,
is 200, ma'am.
First line. 180.
Baseline. Okay, people, baseline one more than 180.
Decrease variability. No acceleration.
200 is abnormal feature, ma'am.
Okay, see here, people, there is more than 180 baseline. So it is an abnormal feature. One abnormal feature. So if one abnormal feature is there, CTG already becomes pathological. Okay.
Okay, ma'am.
So it is already pathological because if you have got one abnormal feature and variability is less than 5, but variability has to be less than 5 for more than 30 minutes to be NR, but it is not 30-minute trace. Okay, so you cannot put according to this trace variability into NR feature. Fine, acceleration decelerations are not there. So yeah, fine.
Okay, ma'am.
Doctora, for this abnormal feature, sorry, I joined late. It is only mean the baseline, you mean? It is the only one, and what else?
Yes, only baseline. See here, I will tell from the beginning. So if you first, this is 10-minute trace. So contraction, if you find, it will be 4 to 5. Now come to baseline. So this is baseline. So this is a part of the CTG where there had been no uterine contraction. Go up and see. So here baseline is 120, maybe 200. Okay. So if baseline is more than 180, so it is an abnormal feature. So you put it here abnormal. Okay. So now acceleration not there. Variability is less than 5, but it is less than 30 minutes. So we cannot categorize this as an NR feature. But if same CTG is more than 30 minutes, then we can put this in a NR feature. Fine. So and there has been no deceleration. So because of this one feature, one abnormal feature can make category pathological. So overall impression will be pathological. Is it clear?
Ma'am,
Okay, doctor.
why is that
The
not a deceleration?
include baseline. There is any another thing? I mean, because I joined late, only I want to know what abnormal features. Only the baseline, or في another
only
feature? There is
in this CTG only one abnormal feature, that is baseline.
And
if
tachysystole,
less
then
than
you
5,
call it.
cannot tell is abnormal feature.
What you are
Like
saying?
this scenario, variability less than 5. You told this one, it is not abnormal feature also.
Okay, so I will repeat it. If the variability is less than 5 for more than 30 minutes, then more than 30 minutes, then it will be NR feature. And if it is less than 5 for more than 50 minutes, then it will be abnormal feature. But in this, we have got trace for less than 30 minutes. Therefore, we are not in a position to put this in any NR category or abnormal category. Is it clear now?
Yeah. Thank you so much. Clear now.
And why is this not a deceleration? There is a drop in fetal heart rate from a baseline of 190 to 170 beats per minute, and the onset to the peak of the deceleration is more than 30 seconds, and it started after the contraction. So shouldn't that be a late deceleration?
This what you towards the end of it you are saying when it is
Yes.
yeah. So okay, see, time wise you can say it, but it has to be more than 15 beats per minute below, but it is
So it's
not
from
looking like
190 to 170.
maybe 10 beats per it has gone 10 beats, so it has to be more than 15 beats below. Okay, it is not there, 15 beats are not there. This is one thing.
From
And
190 to 170. The last towards the end of the trace, like it's at 170 up to 170.
okay, so in that situation you can put it also, but if you have already put the trace under pathological category, then your treatment will be all it will be in the pathological category. Okay,
Yeah.
category will not change. Neither
Can
category.
we take this as tachysystole?
Tachysystole, what we read, it has to be how much?
More than
It has
5.
to be more than 5 contractions. Yeah. So more than 5 contraction will be tachysystole. Maybe this patient, we don't know the
I
whole
think
scenario.
it is hyperstimulation because it is associated with abnormal CTG.
Yeah, maybe there, but we don't know what was the scenario, because scenario I never put. So we don't know that. Okay.
More 5 or more contractions with abnormal CTG will be hyperstimulation, right, ma'am?
Yeah, that will be hyperstimulation. Only contraction will be tachysystole.
Madam, in reduced, the variability is in some areas it is half box, ma'am. So it is some areas it is 5 beats, no variability. Half box is.
Yeah. See, variability, it is a range. All trace you cannot get same variability. So
Okay,
we are
ma'am.
worried about less than 5 and more than 5. Okay.
Okay, ma'am.
So different part of trace will have different variability. Okay, who wants to do?
Can I take it?
Can I?
Yes. So two people are speaking, Shraddha and Sujata. Okay, Shraddha, you do it, then Sujata will do it.
Okay. So this is a CTG of a woman. The paper speed is okay. So the number of contractions in 10 minutes are 1, 2, 3, 4. Around 4 contractions in 10 minutes. And I think each contractions are, some of the contractions are more than 60 seconds. Then the baseline heart rate is 1 is 165. It is 165. Then the variability is more than is 165, which is a non-reassuring feature. The variability is more than 5 throughout. There are no accelerations. There are no decelerations. So overall, this is a CTG for 30 minutes. It has one non-reassuring feature. So this is a suspicious CTG.
Excellent. So here contractions are 4 to 5. Baseline, this is 170. So, you know, this is 10 beat per minute. Okay, this is 10, not 5. This is 10. So this is 160 and it is going more than that. So this is 170. Though whether it is a 165 or 170, it will be an NR feature. No acceleration, no deceleration, variability is more than 5. So there is one NR feature and it is suspicious. So very good.
Thank you.
Now,
Hello, ma'am. I have a question. Ma'am, previous CTG, please. I have a question.
Yes.
Ma'am,
Yes.
can you explain, ma'am, last CTG, ma'am, can you explain how we can count the contraction between you? You said that in 10 minutes you can count the contraction in this CTG graph. How we can count? Can you explain?
Okay, so this will be
No, ma'am. Next one, not this one. The next one. Yes, the which was discussed here just now. Yes, this one.
yeah, this is very difficult. Basically,
Yes,
so
this one. Can you tell?
from here to here, it will be 10 minutes. Okay, so you can do 1, 2, 3, 4. Okay.
Hello, Doctora. Why this one abnormal feature only? It is not abnormal feature. This baseline is 170.
Yeah, so who said abnormal? We said non-reassuring.
No. I am telling why not abnormal. This 170 baseline.
One more than 180 is abnormal.
This is not reassuring only.
Yeah.
Okay.
Okay.
Okay. Yeah.
Yeah, 161
Yeah.
to 180 is non-reassuring. More than 180 is abnormal.
Yeah. I got it. Shukran. Thank you.
Okay. So who was next?
Can I?
Yeah.
I will do.
Yeah. After Sujata, you can.
Okay. This is defining risk in contraction. Contractions is between these two. We have 1, 2, 3, 4 contractions, and they are all they're lasting for more than 45 seconds, almost for a minute. Some of them are. So it is then coming to the baseline variability. Coming to that, it is tachycardia with around 180, 180 heartbeat, and then some places here it is going even between the contractions. Here it is going to around 190 also. So 190. So then after that, you have no accelerations, and coming to here you have acceleration. Um, Acceleration, we have one acceleration, and then deceleration. To see deceleration, we don't have a deceleration, but because it is a tachy cardia with tachysystole, you can say hyperstimulation with the tachycardia. So it is abnormal because it's more than 180. So it's an abnormal CTG with hyperstimulation.
Okay.
Pathological.
Pathological. Okay. I put this under suspicious. Why?
But
Because
there is only one abnormal feature, no? This baseline heart rate only is high. Yes, there are
Dr.
no other
Priyata,
features.
can we keep it as normal CTG? Because if the acceleration is present, we term it
no,
as normal CTG.
but we will not. No,
The
we will not put it
baseline
as
heart
normal.
rate is high.
Maybe see, if we are doing question answer, like if we are in the exam, so if CTG is there, we have to do according to nice categorization. But if we are in a real life scenario and if we see this CTG, so like we will not do anything. Okay, one acceleration is there, so baby is doing fine. So there will be some feature, maybe oxytocin or maybe something is going on. We will correct that. But as the acceleration is there,
Yes.
so we will not be like very unhappy. But in the exam, you have to do.
This tachycardia could be.
Okay, so here, this is 10 minutes from here to here. So contractions are 1, 2, 3, and 4. Here, whenever we calculate baseline, so we take a part of CTG where no contraction is there. So this is the place where there is no contraction. So exact same we will take above. So here see, it will come as 180. Now you are taking this, but this is corresponding to contraction. Okay, so we will not take this in the baseline.
This contraction, just after the acceleration, there is a gap between the contraction, which is going to more than 180. It is going almost to 190. Here, the first one. See the one, after that acceleration. Yes, that part.
This this is more. Yeah, you are right. This is more than 180. This is more than 180. But here,
It could
like
be, Dr. Priyata, it could be some because of some maternal pathology, maybe hyperthyroidism or something. Because still the accelerations, the NICE guideline also says if the acceleration is present and variability is reduced, or then the CTG is normal.
yes, acceleration is there, so we will not like do anything. Maybe some surrounding situation is going on that has to be corrected. Okay, so but if you have to do like category, somebody's mic is on, I don't know. Please mute yourself, otherwise it becomes very difficult. Okay, so depending upon the situation, so if it is more than 180, then you will put this under abnormal, and if it is less than 180, you will put it under suspicious. But for any kind of CTG, what you will do first, you will start with conservative, then you will observe. Maybe this will improve by itself. Maybe some maternal tachycardia is there. Okay, because we don't have scenario like what was the condition of patient, so it will be very hard to describe it. Okay, who wanted to do? Who wanted to do?
Can I take it?
Yeah, Nikita. Okay, Nikita, yeah, fine.
So yeah, we cannot define the risk. Number of contractions will be around 4. Yeah, around 4 contractions, and baseline heart rate is there is a shift in the baseline actually. In between contractions, I'd say it is around 160, and then there are accelerations and no decelerations. And yeah, it's a bit difficult one.
Difficult one. Why difficult one?
Ma'am, there is a shift in the baseline. So will it
It's
be
not a shift in
automatic?
the baseline. So this is not shift in the baseline. These are like accelerate.
Okay, in that
Okay.
case, then it will be a normal.
Yeah. So if you
These are
take like
contractions, ma'am.
no, these are contraction. 1, 2, 3. These are contractions. Here maybe they have not recorded it well. So if you see this part, this part, okay, this from here to here, this will be 10 minutes. So this will be the part where there had been no uterine activity. If you see it here, so here it will be your baseline. This will be like your baseline. So baseline is coming nearing 160. So it's fine. Okay.
Yeah, 160.
Yeah. So these are accelerations. And deceleration is not there, significant, and variability is fine. Yes, so this is normal CTG. Okay. No, okay, sorry. So that was this is normal. So someone wanted to do someone from I don't know Oras or what? He wanted to do, I don't know.
Ma'am, me Uruj.
Okay, yeah, Uruj. Yeah, do it.
Acha, the risk has not been explained. This is a little difficult CTG. And the contractions, there are 1, 2, 3, 4, 5 contractions in 10 minutes. And the baseline is baseline is 150 or 160, 150 to 160 baseline it is. And no, baseline is 140 to 150. Baseline is 140 to 150 baseline. And there are no accelerations and there are multiple decelerations. And decelerations are variable after the onset of contractions. So there are late decelerations. There are late decelerations. Ma'am, means ke late decelerations more than 50% of the contraction.
No,
There
these are
late
not
decelerations.
Variable decelerations.
Variable. No shape, no character.
Remember, the onset of the deceleration is after the contractions. That's why I said first I said that it is variable decelerations, and more than 50% of contractions it is.
Yes, and
And
there are
variability is more than 5. Variability is more than 5. So, ma'am, if the decelerations are present in more than 50%, so that will be a normal feature.
Yeah, if it is less than 30 minutes. So this stage is less than 30 minutes, less than 30 NR feature. Okay, so
More
you have
than 50% of the contraction.
Yes, so it is 1 NR feature. Okay, And what is
baseline is normal. The variability is also normal. There are no acceleration.
Baseline is not normal. See, here is no contraction.
Ma'am, I am not able to recognize the baseline here. Actually, I am not able to recognize. There are multiple decelerations. That's why I was confused.
Yeah. See this part of CTG. If you see this part, no contraction. Just go above and see. So this will be the baseline.
Yes, I was confused in between 170 and 140. That I was confused. Yes.
140 is here. No, it is not 140. You just see a part.
If that is the heart rate, then there will be the 170 heart rate. There will be NR features. 2 NR features there are. So means the pathological, the categorization will be pathological.
Very good. So this is so here this is baseline. This is 170 1 NR feature, and variable deceleration, loss of variability in between deceleration, present more than 50%. So these are variable deceleration with feature less than 30 minute NR. So we have got 2 NR feature. So it is overall pathological. Okay,
ma'am, can you explain, ma'am, can you explain that you said it is less than 30 minutes CTG? So, ma'am, when we can say that it will be abnormal? If it is variable decelerations more than 50% of contractions of more than 30 minutes, then it will be said abnormal.
Yes, I think you joined late. If the variable deceleration with feature less than 30 minute NR feature, more than 30 minute abnormal feature. Okay. So this trace is less than 30 minute. So we will, these are variable deceleration with feature. So we will put this under NR find, NR feature.
Sorry, ma'am. One more question, ma'am. I was present at that time also, but ma'am, you said some vice versa. Two things you said. Okay, if it is less than 50% of contractions and more than 30 minutes, if it is more than 50% of contractions and less than 30 minutes.
Yes.
This thing I want to, ma'am, revise by you.
Okay, so if the variable decelerations are there and they are with features, and if they are present more than 50% of contraction, then it has to be less than 30 minutes for NR feature. But if we see very rare NR contractions, rare variable deceleration with feature, and they are present less than 50% of contraction, then time will be more than 30 minutes. We will take that as an abnormal feature. Is it clear? So if it is present more than 50% of the contraction, so less than 30 minutes will be NR feature. But if they are present lesser than 50%, then more than 30 minutes will be an NR feature. Is it clear?
Ma'am, so here it is present in 100% of contractions.
So it is more than 50. More than 50.
Yeah, so with every contraction it is coming. That's what I wanted to confirm. It is 100%.
We are not worried about 100, 60, 70. We are worried less than 50, more than 50. That's all. Don't confuse. Less than 50. Variability less than 5, more than 5. Okay, make your life easy. Okay. Who wants to do?
Hello, ma'am. I have a doubt.
I can do it.
Question, please. Shall I?
Yes. Yeah, yeah, you can do Muntaha. Who was asking doubt?
Ankita, CTG number 15, ma'am. Ma'am, here variable accelerations are variable decelerations are present for more than 50% of the contractions.
Yes. More than 50%.
But the trace is less than 30 minutes.
Less than 30 minutes is NR. Is it clear?
Okay, yes, ma'am. Yes, ma'am. Yes, ma'am. Got it.
Okay. So Muntaha was doing. So this is.
Yeah, Miss May, basically more than 10 minutes CTG. There are almost 3 contractions in 10 minutes. 3 contractions in 10 minutes. And the baseline is around 140 with no accelerations, no decelerations. So, and variability is more than 5. So it's a normal CTG.
Yes. So if you see without categorization or nice, it will appear abnormal to you. But if you put it in a feature, it becomes normal.
True.
Okay.
Thank you. Thank you very much.
Yeah. Who wants to do next?
I'll do next, ma'am.
Yes, do. Meena.
So there is less than 1 contraction in 10 minutes, approximately 1. And the baseline is 140. And there is 1 acceleration. And the variability is decreased, less than 5 beats per minute.
Or?
And 1 acceleration is there. There are no decelerations. So this is basically a normal CTG. Or if we think that the variability is less than 5, we can prolong it for another 30 minutes and see.
Yeah.
To have a reassuring, non-reassuring if we think it to be.
Yes. Very good.
Thank you, ma'am.
So if contractions are 2, baseline is 140, acceleration is there, deceleration not there, variability is less than 5. But the problem is that this is less than 30 minutes. Less than 30 minutes, then we are not in a position to put it under any feature.
Category.
So we can't help it. But if in your exam this trace becomes 30 minutes and you have got variability less than 5, then it will be NR feature.
Non-reassuring.
Become the
Suspicious.
CTG becomes suspicious. So it is important people to see how much time CTG they have given. Okay.
Yes, ma'am. Thank
For
you, ma'am.
2 and 3, yeah. Okay, very good. Who wants to do next?
Me.
Okay, yeah.
Sinusoidal pattern.
Yes.
No.
Yes, this is so you have to say this is sinusoidal pattern. So now you can see it will lie in between 5 to 15 beat. There is no variability, and there are sine wave like. So it is an abnormal feature. Okay, abnormal feature. So we have got one abnormal feature. So one abnormal feature, CTG becomes pathological. Okay, you can do the second also because people have given answer. Who was doing? You can do this also. Who is there? Who was doing?
Is
Okay,
there
you do.
anyone?
Yeah, you can do it because that answer was given by everyone.
Yeah, in the CTG, this is the intrapartum CTG also, and there are contractions about 3 and 10 minutes, and the baseline heart rate is 130 beats per minute, and variability is about 20 beats per minute, and there are accelerations also present and no deceleration, and it's a normal CTG.
Okay, very good. So it is normal CTG, baseline like 135, acceleration is, this is acceleration, this is acceleration, so we are happy. Variability, you can see so good variability, no deceleration, normal. Okay, who wants to do next?
Ma'am, shall I?
Yeah, do.
It's a 10 minutes trace. 3 contractions in 10 minutes. Baseline is 130. Variability is less than 5 beats, ma'am.
Very good.
No accelerations. And there is no decelerations, ma'am. So it is a one non-reassuring feature and it's a suspicious trace.
No, which
Where
is
is
non?
decelerations?
These are deceleration. These are deceleration. These are deceleration. Very good, excellent. Who said early? Very good. So these are copy, total copy. You see this, you see this.
Yes,
You
mirror image.
Yeah, these are early deceleration. Okay, so what is the feature?
One non-reassuring feature, ma'am, suspicious trace.
No, what is NR feature? What is NR feature?
Variability is less than, ma'am.
But it cannot be accounted because it is less than it's 20 minutes CTG, not 30 minutes CTG.
Yes.
Yes, less 10 minutes. Okay.
Okay. So there is no feature, no NR feature here.
Okay, ma'am. Normal trace.
Why no variability is less? You are very right. Anyone can see this.
Why not suspicious? Because there is early deceleration. Why not
Early
suspicious CTG?
Early decelerations are features of normal CTG. Early deceleration are not counted as abnormal.
Early decelerations are physiological. Anywhere you see early deceleration, so we are happy about it. Okay.
Although these decelerations are although very characteristically early, they're only 10 beats. Like it's like I don't know, it should be more than 15, right?
Yeah, ma'am, more than 15, but looks
Looks like it, yeah.
It has to be more than 15. You are very right. But if you see them, so these are mirror images. Okay.
Yeah. Yes, ma'am.
Okay, so in this CTG trace, only one feature is there. Variability is less than 5, but it is it has to be 30 minutes. Then we can put NR. So we are not able to put NR. So we will say here abnormal, normal only. So this is normal trace. Any other next person?
Can I take it?
I will do.
Okay.
3 contraction per 10 minutes. Baseline about 150.
Very good.
Second, no acceleration. We have early deceleration also. Early deceleration, yes. Early deceleration and variability less than 5, but less than 30 minutes. Almost normal CTG. Normal
Almost.
CTG.
Yes, very good. You are right.
Thank you.
So this is
Thank
normal.
you.
Contractions are 3. Baseline is, here is the baseline 150. Acceleration not there. Early deceleration is there. Though again it is not 15 beats or the 120, 130. Okay, not 15 bits, but these are early. Okay. Mirror image. Variability is less than 5, but as a trace is less than 30 minutes. So we cannot put it under any feature. So it is normal. Who wants to do next?
Ma'am, I want to do.
Okay, Madhu.
Yeah. This is the 10 minutes I want to see. But the 2 contractions are there, and baseline is it is about 160, ma'am. Am I okay?
Yeah, continue.
Yeah. It is 160. 160 is the beats, and variability is good. 10 beats, almost 10 beats are there, and deceleration is there. That is the late deceleration. One day late deceleration is there.
Okay.
So late deceleration is less than 50% in the 10 minutes. So it is one of the non-reassuring feature. So it is not suspicious citizen.
Very good. So
Thank
contractions are only like in 10 minutes, you can see 2 contractions. Baseline is 160 or one more than like either 160 or 155, but it is nearing that. No acceleration. There are late deceleration. So this is a tip of contraction, and here the deceleration starts and it ends here. Okay. So these are late deceleration, and late deceleration are there for only 20 minutes. So late deceleration less than 30 is NR feature. So it is suspicious. Very good.
Ma'am, in the previous
Ma'am,
one, number of
if we count
contractions, there are 2 or there is only 1? Ma'am, I can see 1 contraction in 10 minutes.
From here to like this is 1, 2, 3, 4, 5, 6, 7, 8. Like maybe here till here it is 10. Okay.
Okay.
Ma'am, duration of deceleration, can we count here?
Duration of deceleration, yes, you can count here. So this will be 1 minute. Okay. So from here to here, so this will be, you can say 1 minute, 2 minutes, or maybe nearing 3 minutes if it is coming. Okay. So you
Ma'am,
will
what's
count
the baseline?
Baseline. See, this is the part of CTG. This one, here there has been no contraction. So here there is no contraction. So you go above and see. So this appears to be baseline. Yes.
Ma'am, deceleration for more than 3 minutes or 3 minutes will become abnormal, right, ma'am?
Yeah, more than 3
Makes
minutes.
it pathological.
Yeah, more than 3 minutes is abnormal. You are right.
Ma'am, here more than 3 minutes slide.
Prolonged bradycardia more than 3 minutes is abnormal.
Yeah, more than 3 minutes is abnormal.
So it's a pathological CTG.
Yeah, that
No,
makes it.
It is deceleration, not bradycardia. You see, tip of the deceleration is 120 beats per minute. It is not bradycardia.
Yeah, prolonged deceleration for 3 or more minutes makes it abnormal, which makes it pathological.
Yeah.
It's not acute bradycardia, but it is
Yeah.
one prolonged deceleration for 3 minutes. So the prolonged deceleration for 3 minutes is also abnormal feature. So one abnormal feature will make it pathological. Okay.
Yes, ma'am.
Yeah. So actually, when I write answer, so I saw late, but I never calculated this. Therefore, I never put it. Now, if it is more than 3 minutes, it will be an abnormal feature. Then it will make it to a pathological.
Ma'am, is it in this slide? Is it pathological or suspicious? I'm confused with it.
You see, if you see this contraction, this deceleration, so this will be 1 minute.
Ma'am, starting here it is there. So 2 minutes, I think, ma'am. It is 2 minutes only.
Like this is
From
starting
here to here.
1,
Yeah.
2, 3.
1
3
and
minutes.
2
It
minutes.
lasts.
2.5 minutes, madam. Actually, it is
It
2.5
lasts for
minutes.
3 minutes. It lasts for 3 minutes, but
so this
isn't
is
it suspicious? Suspicious only. Because it is deceleration, not bradycardia, acute bradycardia.
Acute bradycardia.
Acute bradycardia or prolonged deceleration for 3 or more minutes. Both will come under abnormal, dear.
Oh,
Yeah, both will
thank
come
you.
under
Here
abnormal.
it is only 2.5 minutes it is coming.
Yeah.
I'm seeing this one.
It
Only
is
2.5 minutes is
coming
coming.
at more than 3, right? If we can, if we can.
Yes.
no, it is 3.5
Well,
minutes.
so it will be abnormal, no? So it will be late. It will be
Yes.
this prolonged deceleration. right?
So you 1
Even
minute is if you come
non-reassuring, the
So
baseline heart rate
so
is
you may
to
to
start with.
and like it is coming nearing 3 minutes. Okay.
yeah.
So nearing 3
Can you
like
show, ma'am, where and from where to where we are calculating?
yeah, see it is starting from here and it is like ending here. So from here to here, from here to here. Okay.
2.5 minutes.
Yeah, it is coming nearing 3. So again you will have more like this is only one decel we are saying, but maybe you will get a good trace where not only one other deceleration will also be there. In that situation it will be easy because commenting just on a one deceleration is like becoming a bit difficult. But if it is more than 3 minutes, clear more than 3 minutes, then it will be abnormal feature. Then in that situation that will be pathological. Okay, so this is also
We will
this.
calculate the duration from the baseline from where it has dipped, right, ma'am? So here the baseline is around 160. Okay. So even behind 160. Yeah. From
Yeah.
there, from the baseline, we are calculating the start of the deceleration. So that makes it around 3.5 minutes actually.
But to be called as a deceleration, the heart rate may be less than 15 beats per minute from the baseline. And so I think the start of the deceleration is calculated from the point of 150 about less than 150 beats per minute, and so the duration is less than 3 minutes, I think, isn't it?
Okay, so maybe see, maybe in the exam they will give bigger trace, so you will not be have to comment on
Yeah.
one.
Yes.
Maybe so
True.
many
Yeah.
there. So with when single usually when single prolonged comes, so it will be only one deceleration in whole CTG, like what we did in a rupture case. So if it is coming repeatedly like this, so this will give a picture. This is not single prolonged type of picture. So it is
Yeah.
late only. Okay, that
Yes.
we just saw. Maybe some will come with that single prolong. So that is a different type of traces that I will show you again. Okay, and maybe in the exam you will have like 30-minute trace will be there. So you need not to comment on one. So there will be more traces will be there. Okay, more deceleration. So that will give you a correct picture. Okay.
Okay, thank
Some
you, ma'am.
making like judgment from one becomes difficult. Okay, who wants to do next?
Me?
Yeah, you can do.
Yeah, as a intrapartum CTG, and there is a contraction, so about 4 in 10 minutes, and the baseline heart rate is here is 160 beats per minute, and variability is more than 5 beats per minute, and there are there are late decelerations. There are late deceleration in uh, less than 50% of contractions.
No, they are almost with every.
More than 50.
More than 50% of
It is more
contraction.
than
More than
50%.
50%. Oh. One question, please. How do you count the percentage of the deceleration with contractions? It can with every contraction. It means 100%.
100%, isn't it? More than 50%.
Yeah, more than 50% is there. Even looking at the trace, just look at the trace, you'll be able to see is more than 50%.
Yeah. More than 50% of contractions.
Yeah. So what is a feature?
So more than 50%.
So yeah. So
Suspicious CTG.
very good.
Is it?
Yes.
Is it 30-minute CTG?
It is not 30 minute. It is less than that.
21 minutes.
It is less than 30 minutes. That I know. So contraction is 3.
20 minutes.
Yeah. So it is 150. Baseline is 150. If you see, this is like 10 minutes. So this is the place where there are no contraction. You see there. So this will be the baseline. So baseline will be 150, or you can say like 155. There are no acceleration. There is clear late deceleration, and these late decelerations are present less than 30 minutes. Less than 30 minutes is NR. So we have got one NR feature. So overall it becomes suspicious. Okay.
Ma'am, for variable decelerations, we take less than 50% contractions, more than 50% contractions. But for late decelerations, less than 30 minutes and more than 30 minutes, right, ma'am? We don't take the percentage of contractions.
I think yes.
Yes, we are confused about that in most of the times,
Yeah,
especially in
true.
the exam.
No, you will be confused. I have to go back. Okay, see that. Okay, yes, for late deceleration, that 50% is not there. It is for variable only.
Yeah, so it will be easier to remember now. Late deceleration less than 30, late deceleration more than 30.
Yes. Okay, we have done this test, 23 number. Okay, who will do 24? Who will do?
Can I take it?
Yeah.
Hello?
Yes. Yes.
The number of contractions are around 3. 3 contractions are there. And the baseline heart rate is around 120 with good variability. It's more than 5. And there are early deceleration. Or is it
early or variable?
No,
This one.
they are variable. They are variable deceleration with more than 50% of contractions.
Their
So
mirror images.
Yeah, they are mirror image, but
yeah, but from that less than 30 seconds rule, na, from the start of contraction to the trough, the midline, it is less than 30 seconds. So that will be a variable. So it is, yeah, it's suspicious.
Very. So it is suspicious. Why? Because it has got one NR feature. So here contractions, if you see in this 10 minutes, so 1, 2, 3 contractions are there, and baseline it will be 130. Okay, here there are no contraction go above. So this is 130. There are no accelerations. There are variability is fine. If we see the here, variability is fine. Then these are variable deceleration. Okay, they are no, they are vary in shape and size. This is different, this is different, this is different, this is different. Okay, variable deceleration, they have got like they vary in shape, size and depth. So they have got concerning feature. There is no variability in deceleration. No variability, no variability. Here you can even see late return also. And these are present more than 50% of the contractions. But the trace is for less than 30 minutes. So it is NR feature. So overall it is suspicious. So you did well. Who wants to do next?
Ma'am, can I try next?
Yes, ma'am. This is Tanya.
Yes, before that somebody was asking something. Yes, what is the question? What is the question? Nobody asking. Okay. Okay, who is doing?
Yeah, Tanya, ma'am.
Yeah, Tanya.
Okay, this in 10 minutes tracing, there is contaction 1, 2, 3, 4. 3 to 4. 4 contraction in 10 minutes, and baseline fetal heart rate is, I cannot say.
No,
Ma'am,
you can see
210, 180, then ma'am.
this is 150, this is 180.
Okay.
160.
Then this is near to 155 to 60.
Yes.
Okay. And there is no acceleration.
Mm-hmm.
And 1, 2, 3. Ma'am, there is deceleration, and
These
this
are
is variable or late.
yes, variable decelerations.
Variable decelerations.
Yes.
Yes, ma'am, variable deceleration, and
With the features, no variability in between deceleration.
ma'am, absent of shouldering.
Yeah, that is there, but there is no variability. You see, no variability.
Yeah, yeah. And
Okay.
when ma'am,
So how you
Suspicious.
very good. So here contractions in 10
Suspicious.
minutes. Yeah, 4. Baseline rate is like 155 or 160. And there are no accelerations. There are variable decelerations and variable deceleration with characteristic. Like no variability is there. So and these are present less than 30 minutes. So 1 NR feature. So overall it becomes suspicious.
Madam,
Who
all
wants?
of the traces are less than 30 minutes. And when are we going to comment on anything that is above 30 minutes?
See, I actually
ईमान
in
इसको
new.
खाना दो चेरी को मुझे चाट रही है.
Okay, Oroch, you have to mute your mic. So yeah, you are right, but actually this classification changed in 2017 to 30 minute. Okay, previously they used to comment on 20-minute trace. So whatever the traces we have got, these are for 20 minute. So therefore, like I was not able to get any 30-minute trace. Fine.
So if it's a 30-minute trace, then they'll start to become suspicious and then pathological?
Yes. So therefore,
Okay.
with every trace, you have to see how much minute they have done. According to that, you have to find out what are the feature. According to feature, you have to find out category. Okay.
Okay, thank you.
Yeah, who is doing?
Can
I do, ma'am.
I will do.
Will do, ma'am.
Me?
Okay, so I have 2 people in line. Rajni, you can do first. Then Abu Mustafa
Okay.
can. Okay, I have got no issue.
Okay, ma'am. This tray has in 10 minutes there are 1, 2, yeah, 1, 2, 3. 3 contractions in 10 minutes. Hello, ma'am?
Yeah, I'm listening.
Yeah. There are 3 contractions in 10 minutes, and the baseline heart rate is at 145, around 145 per minute. And there are early decelerations, almost mirror image.
Variable deceleration.
These are variable.
Variable in different shape and size.
They
Okay,
vary
yes,
shapes and size.
this
Okay,
side.
vary shape and size.
Yes,
I
ma'am,
showed that.
variable decelerations, yes. And the variability is around 345. This is 60. So variability is also decreased. So there are 2 non-reassuring features. So it becomes suspicious and pathological. 140, 1.
So here there is no contraction. If you see variability here, from here to here, so it will become more than 5. Okay.
Yes, here it is better. Yes.
So
I was seeing this side here. I was seeing here.
Suspicious.
So it is
Yes, suspicious CTG.
one
Variable deceleration
NR.
in 20 minutes only.
Yes, this is suspicious. Fine. So contractions, like if you take, it will be 3 to 4, and baseline it is like it is somewhere here. So 150, nearing 150. There are no acceleration. There are variable deceleration. These are with characteristics. Okay. Because no variability in the deceleration, lots of variability, less than 30 minutes. So it becomes an R feature. Okay. But if the same trace is there and it is more than 30 minutes, then in that situation, this will become this will become abnormal feature. Then CTG will become pathological. But right now,
But Dr. Priyata, these decelerations, they are exactly coinciding with these contractions.
Yeah, they are coming with peak. Yeah, you are right. But they vary in shape and size. These are not ever that, like in early, everything will appear same. All deceleration will be same types.
Even the size.
Is it because of the size we are saying that it is variable?
The start to the peak is less than 30 seconds here.
Start from here to here. It is less than 15 seconds. No, sorry, less than 30 seconds. This is one thing. Second, they vary in shape and size. Okay, these are not uniform. So these are variable. Okay. Yeah.
And if this went on for more than 30 minutes,
Then,
you
ma'am,
would
loss
say
of
that it will
variability.
Loss of variability is there. Yeah. This loss of variability will make it a suspicious
Concerning feature.
with feature. So this is variable deceleration with loss of variability present in 50% of the contraction. So this is non-reassuring feature. Okay. One NR feature makes it suspicious.
So if in the
And
same CTG, if there was no any feature with the variable deceleration, then it will be normal, right?
if this is not there, then it will be normal.
Yeah, then it will be considered, that feature will be considered reassuring because it is less than 90 minutes and no concerning characters.
Yes.
Okay.
Without character, more than 90 minute will be NR feature. Okay, who wants you to do this? Okay, do this.
I will do. 3 contraction per minute, but mild contraction. Is line about about 150, 160, 150, 160.
Okay.
No acceleration, but we have deceleration, multiple acceleration and deceleration and variable deceleration also. Deep deceleration. Variability good. No shouldering.
Yeah, loss
Long
of
to
variability.
recovery. Long to recovery. Yes.
Yes. Delay recovery, no
Yeah,
variability.
yes. Yes. Pathological CTG.
So why you are saying pathological?
Because long time need to recovery and no variability and deep deceleration.
Must be 90 minutes to say this is pathological. Must be in 90 minutes.
That has to be it has. So these are variable deceleration with characters, but it is less than 30 minutes. So you will
Less than
put that in the
suspicious.
less than 30. Less than 30 will make it
Suspicious,
NR
yes.
and suspicious. But if same CTG is there and it is 30-minute trace, then it will become pathological.
Yes.
Okay.
Okay.
Okay, who wants to do next?
Ma'am, shall I take it?
Yeah.
So it is there are about 1, 2, 3, about 4 contractions, but also what is prominent is there is acute bradycardia lasting more than 3 minutes, so which makes it abnormal and pathological.
Okay, very good. So this is more than 3 minutes. And usually when this type of CTG comes, so you will find only one big prolonged deceleration. If it is a late deceleration, so there will be many same kind. So you will get a bigger trace. So that issue will not happen in the exam. Okay. So now you can easily make out what we were discussing, late deceleration. That was not this kind. This is very clear. So this kind of deceleration when comes, it will be only one in your trace. Okay. But late,
so here there is a shift in baseline also, correct, ma'am?
Yeah. So in either abruption, rupture, or cord plus some emergency had happened, then this type of picture comes. Okay.
Yes, ma'am.
So they will be
Yes.
like, yeah. And if these are the easiest traces, because anyone looking like if the sine wave is coming or if single prolonged deceleration is coming, so these are the easiest. Okay, who wants to try?
Can I try this, ma'am?
Hello.
Yes. Yeah.
In the last trace, the small square over here, it is equal to 1 minute. Shall I take or 30 seconds?
1
This
minute.
is 1 minute.
The small
This is 1 minute. Sometimes they will CTG will have one more like one more lines are there. One more line is there, then it will be 30 seconds.
Okay.
It is 1 minute.
Okay. Thank you.
Okay, who wants to do
Can
next?
I take this, ma'am?
Yeah.
Yes, ma'am. Here at 10 minutes, 1, 2, 3, 4, 5 contractions are there, ma'am. 4 to 5 contractions in 10 minutes. And the baseline is 120, 30, 40, 50. Near about 160, ma'am.
Yeah.
The baseline is 160 and the variability is good, ma'am. Variability is more than 5. And these are variable decelerations with concerning features. So it makes it one NR features. So it is a suspicious CTG, ma'am.
Very good, excellent. So contractions are 4 to 5, baseline is 160, acceleration not there, deceleration, variability, it is less variability that we can easily make out. But it is less than 30 minutes, so we are not able to put it under any feature. But variable deceleration with feature. Now you can see this W is there. Loss of variability is there. It is less than 30, so it will become NR feature, so suspicious. So very good. So
Is
who
it,
wants to
ma'am,
do?
isn't that a 30-minute trace? The trace, isn't that a 30-minute trace?
This is 10 minute and this
Yes,
is one more
30 minutes.
No, this is 30 minutes.
9.
No. This is
27,
110.
27.
1, 2, 3, 3. Don't tell me. 9. 27 minutes CTG.
Less than 30 minutes actually, na?
Okay.
Yeah,
Less than
27 minutes.
So if it is more 30 minutes, if it is 30 minutes CTG, then it will become pathological. Okay.
Yeah.
If it is complete 30 minute CTG, it will become pathological.
Ma'am, it should be more than 30 or 30 for pathological.
30 or more than 30.
30. Okay, ma'am.
Okay, who wants to do?
Can I, ma'am? Can I?
Yes.
So in this CTG, there are very few contraction, 1 or 2 very mild contraction, but the baseline heart rate is 180. There's no acceleration, and but deceleration is there, yeah. But I mean, is it called deceleration? And there's no, it's not. So basically, there is one abnormal feature. There's 180 this heart rate. So shall we go for pathological?
Pathological, yeah.
Variability.
Yes. It is pathological.
Variability.
Variability is less. It is less than 5 variability, but it's not a 30-minute CTG, so it's not included in the criteria.
Yeah. So here baseline, yes, you are right. So here baseline rate is, it is more than 180. So one abnormal feature is there. So one abnormal feature will make this trace pathological.
Yes, ma'am.
Okay. So Jatinder, are you there?
Can I do this one?
Yeah, you can do.
Hello? Prolong
Previous,
bradycardia for more. This
one second.
CTG, there
Previous.
is prolonged bradycardia, more than 3 minutes. So pathological CTG.
Very good. Now you see, so fast you are doing. So this is more than 5 minutes. Okay. So this is abnormal feature. So CTG becomes pathological. So these are the easiest to do interpretation. Okay. Who wants to
Yes,
do?
thank you.
Shall I take it, ma'am?
Yes.
So there are about one contraction in 10 minutes, with baseline heart rate of about 120 with good variability and accelerations, no decelerations, normal CTG.
Very good. Yes, this is normal CTG because here baseline is so if you take this, so here there are no contractions, so this will be like baseline. And so big acceleration, we already know this has to be abnormal. Variability is more than 5. You can see this much is the variability. Overall impression is normal.
Ma'am, I have one
Yes.
query. In the
Yes.
previous slide, what about the uterine contraction? Is it irritable uterus?
I don't know. I won't be able to tell about that. Maybe they have not done it very well. Okay, they have not done it well.
Ma'am, CTG number 30, please. 30.
I'm sorry, in this CTG, can you please?
Yeah, so here what is happening, I mean, at the first time when I saw the part in the most left part, it is corresponding directly to 180.
I think the CTG is baseline heart rate is 180, but loss of less variability is less than 5, and so an unprovoked deceleration present in the early bed. And so for my comment, it may be a case of preterm baby with poor placenta function, isn't it?
Actually, I never put scenario, so I have got no idea. So it is like basically, so this like this is 180, so it is appearing more than it. Okay, so more than 180 makes abnormal, so makes this pathological. Variability is also less than 5. So if variability is less than 5 and it has to be more than 30 minutes, then we can put that in a feature. So only on the basis of heart rate. So if I'm putting this under abnormal category, it becomes pathology.
Yes, in the early phase of the CTG, can we put it as a deceleration? Can we regard it as deceleration? Because it is reducing the baseline about 15 beats per minute for about 2 minutes.
Yeah,
is it a kind of deceleration?
You can say it is a deceleration, but it will be very hard to categorize this much.
Yeah.
Difficult to
Because
interpret. Yeah.
contraction is not there.
Yeah.
Okay. Jatinder, you want to do? Yeah. Yes.
Here, more than 15 beats per minute deceleration.
See, this is 120, this is 130, so this is 10. So it is more than 10, so you can say 15 beats, and also it is lasting more than 15 seconds. So it is a deceleration, but it is only one deceleration, so you can't put it under any category. Only when what you will do. This is looking this tachycardia. To me, it appears that some infection is there. Maternal tachycardia may be there. Therefore, this kind of picture has come. Maybe
even
because
if it is deceleration, it is still a pathological CTG, right? Doesn't make any difference.
This is pathological CTG.
Excuse me, ma'am. In the last CTG about the baseline variability, can you please comment? Is it like more than 25 beats for more than 25 minutes? Like 15 to 25 minutes will it be?
This
Baseline
one,
variability.
you
Yeah,
can take
and
it.
also in other cases, in other part of the trace also. Do you think like that?
If it is more than 25, it will be suspicious, isn't it?
More than 25 for 15 to 25 minutes.
For 25, it should be 10 more than 25.
That's less than 25.
Yes, it's less than 25.
70.
No. How? It is from 120. 140 to 20, this is near 60.
90. So it is like it is coming nearing 20. So one box, so it is like
1 box 5, you know, 5 beats.
1 box 5. So if
5
you
beats.
1, 2, 3, 4. Okay, more than so it is coming here. So it is like 4 boxes, 4.5 boxes, you can say.
4.5
This
box will.
normal variability range from 5 to 25.
5 to
Normal.
25.
Ma'am, on your left side, the baseline variability, will it on the
More
left?
than
Yeah.
25.
And this
So,
one,
but
it is the, yeah.
if you see, this is a like no contraction here. If you,
This
I
one.
don't know, this will, you will not take as a variability, you know. Variability is more going
But
towards
it
acceleration.
should last. It should last for 15 minutes now, which is not happening. And some places I agree it is at 25, but it's not lasting for more 15 to 25 minutes.
Everywhere it
Yeah.
is not 25 minutes, seconds. Sorry, everywhere it is not 25 boxes. So it is very, it is just
Okay.
variable.
Exactly.
Okay. Thank you.
So if it is reaching, sorry, mom, if it is reaching 25 and it is more than 25, at that time it will be pathological, isn't it? For
Yeah,
25 minutes, more than 25 beats for more than 25 minutes, it will be
Yeah,
pathological.
Yes,
yeah, then it,
pathological if more than 25.
Yes.
yes. Okay, so Jatinder, you want
Me?
to do this is last race.
Yes, me.
Twins, this one.
This is a CTG taken from twins because I see the two recordings of the fetal heart rate pattern, and the baseline heart rate is about 135 beats per minute in one trace, and also about 130 to 135 beats per minute in another trace, and variability is more than 5 beats per minute, and accelerations present in the middle of the CTG, and so it's a
Isn't it
normal twin
sinusoidal
CTG.
pattern?
Normal CTG.
Normal
No,
twin
this is
CTG, yes.
Normal CTC
yes, it
in
is
twin
normal.
pregnancy.
It is
Twin
Yes.
pregnancy.
pregnancy.
Yes, actually, one time it doesn't. I have not seen this kind of picture for part 2, but part 3, one station, they show a CTG, and that was a twin CTG. Okay, so this kind of CTG was there in one of the part 3 stations. So coming to answer, so twin 1. So it is almost same. So it will be contractions like 2 per 10 2 in 10 minutes. Baseline it is 120, so it is coming near here 130. There is no acceleration, there are no deceleration. Variability you can say very well more than 5. Overall impression normal. So twin 1 and twin 2 same features are coming here. So these both twin CTG is normal. Okay.
But
Ma'am,
ma'am, in twins, there should at least
in the middle of the
Hello?
trees near before the red line in the CTG tracing isn't be a kind of acceleration because it raises about 20 beats per minute for more than 50 seconds. Is it the kind of accelerations? Can it be regarded as an acceleration?
1 box is 5 beats, I think.
If it is more than 50, it is more than 50, but it has to be more than 15 seconds also. So I'm not able to make out whether it is more than 15 seconds. But yes, if the better trace is there, so we can it can be a acceleration. Okay, but overall CTG becomes normal. It becomes more better. Fine.
Neelam, please mute your mic.
Okay, so with this,
Ma'am, I have a small doubt.
Yes, yes.
Ma'am, in twins, there should at least be 20 beats per minute difference in baseline to trace them like differently. But here the variability is same. The baseline is same for both of the twins.
Yeah, it is appearing same. You're right. But see, what you are saying is right. But I put this type of trace just to have a visual impact that this has come in the exam. Okay, that clear CTG I never had. Only one I got, and it appears to be almost same. So I'm just want to give you a picture how twin CTG look like, because in part 3
Okay,
exam
ma'am.
it comes. Okay.
Twins,
Okay, thank you, ma'am.
twin CTG can be like that because for the fetal heart rate difference in 20 minutes, it is only I think it is only meant for the clinical examination of the twins obstetric examination to make sure that there are multiple pregnancy. There is multiple pregnancy in the womb because to calculate to listen the fetal heart rate by two different person at the same time and count the number and the difference is more than 20. It's show that there are more than one baby in the heart womb. I think it's only for
Yes,
clinical
yes, I
examination.
agree
It's
with you.
not me for CTG.
It is for the
But
clinical
if there
event.
is a heart rate difference when we are listening with a stethoscope, there will be the same difference will be on the CTG trace also, isn't it?
Okay, so see what you are saying. It is for clinical examination, but a CTG, that kind of picture I never read from anywhere. But my sole purpose to put this last trace here to just give you a visual impression how twin CTG will come. But in the exam, you will have a better kind of trace, so you will be able to do better interpretation. Okay, so with this, I would say thank you. Though I have got many question for part 2 also, but but now it is getting too much of late, so I have to close it because these are traces. I made question. I have questions also, so maybe and we have to do another class for that because it is really too long now. So if any one of you have got any question, can ask me. Otherwise, like, thanks for attending.